hello, hello, hello. Am I audible, sir, now? Hello, 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 hello. येतोय का आवाज आता, सर? हार्दिक, आवाज जास्त झालाय का? Hello, hello, hello. Am I audible now? Hello, hello. येतोय आवाज? Okay. Done. Hello, 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 hello. Hello, hello. हॅलो हॅलो हॅलो. हिमांशू सर, आवाज येतोय आता? ओके, आवाज येतोय माझा? हॅलो हॅलो हॅलो. नाही येत? हॅलो, आवाज येतोय का माझा, हिमांशू सर? आय एम ऑडिबल? हॅलो हॅलो हॅलो. हिमांशू सर, एम आय ऑडिबल? हॅलो 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 हॅलो. हॅलो सर, एम ऑडिबल? हॅलो 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 हॅलो. साऊंड टेस्टिंग.
Incoming voice call from Chetan. Incoming voice call from Chetan.
Hello, hello, hello. Yes, students, those who have not done registration, it's a request to you, please do it on the reception, okay? Because if we are not having it in record, then to prepare the certificate, we'll be in trouble, okay? So it's request to all the students, please do the registration.
तिला मनातल्या इच्छा आणि मनातल्या भावना कळतात तिलाच
Good morning, everyone. The guest has arrived, so I request you all to stand up and have a big round of applause for them. Good morning, everyone. The guest has arrived, so I
Please have a
request you
seat.
all to stand up and have a big round of applause for them. Ladies and gentlemen, a very warm welcome to Lotus Business School, where excellence meets innovation. I am Vaidehi.
Hi Rutu.
We are your host for today. As we feel proud to be an Indian, we Lotus family always follow country first. Hence, we will start the event with our national anthem. So I request everyone to stand together and make sure your phones are on silent.
जनगणमन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल गंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Now I invite all the dignitaries to please have a seat on the stage.
Thank you, sir. Welcome you all. At Lotus Business School, we believe in providing our students with not just an education, but an experience that prepare them for the challenges and opportunity of the real world. Today's event, the Pharma Summit 2024, exemplifies your commitment to fostering industries, connection, and promoting academic excellence.
The Pharma Summit 2024 stands as a beacon of collaboration, bringing together the minds from across the nation to engage in an exchange of ideas, innovations, and insights. As we gather today, we embark on a journey towards exploring the frontiers of pharmaceuticals, visualizing the future of this ever-evolving industry.
Before we dwell into our summit, I would like to extend a heartfelt welcome to our esteemed guests, Mr. Anand Mote sir and Prashant Danekar sir, our management trustee and executive director, Mr. Charudatta Bodhankar sir, and our director, Dr. Satish Varpade sir, whose vision and leadership continue to inspire us all.
As we commence this auspicious occasion, it is my honor to invite our esteemed guests, Mr. Anand Mote sir and Mr. Prashant Danekar sir, along with the director, Dr. Satish Varpade sir, to perform the honors of lighting the lamp, symbolizing the enlightenment that will guide us through the proceedings of this day. Thank you, sir. To our distinguished guests, we are honored by your presence and we eagerly anticipate the wisdom and expertise you will impart upon us today. Now, I request Dr. Satish Varpade sir to felicitate Mr. Anand Mote sir. Thank you, sir. Now I request Head Placement Mr. Vivek Keskar sir to felicitate Mr. Prashant Danekar sir.
Thank you, sir. Good morning, everyone. I am Apeksha Hude, the student of Lotus Business School. It is a great honor today for me to present before you our very own director, Dr. Satish Varpade sir. Sir's education is a perfect blend of pure science and management. He did a B.Pharm, follow it with MBA in marketing, along with diploma in labor laws, and completed his educational journey perfectly with PhD in marketing. Sir is associated with Lotus Business School since last 9 years. Sir is Executive Director of ASBM PGDM Institute, Pune. Sir has a rich work experience of 13 years in pharma industry. He started his industrial career right at bottom as a medical representative and moved up from their work as head of marketing. He has worked with several pharma companies like McLeod, Panacea Biotech, Cosmo Healthcare, etc. His 15 years of academic stint has been director with renowned institutes like D.Y. Patil, ICMR, Marathwada Mitra Mandal, IMERT, etc. Sir is also approved PhD guide in marketing management with Savitribai Phule, Pune University. Under his guideship, 8 students have already been awarded PhD. He is author of more than 32 research papers, which has published at national and international level in reputed journals. I am very happy to share that recently Sir has authored 2 books on product and brand management. He serves as a trusted marketing consultant to diverse industries. He is working as advisor to various management institutes. Currently, along with his professional duties, Sir has closely associated with Phule, Pune University committees and professional bodies like Member of Academic Counseling of Savitribai Phule, Pune University, a Chairman of Board of Studies, Member of Hospital and Healthcare Management Board of Studies. Sir is associated with various bodies such as Vice President of Angad Education Society, Chief Mentor of Institute of Applied Management IAM, Executive Mentor of Association of Management Institute in Maharashtra, Executive Member of Director Forum of SPPU. Without further delay, I would like to invite Dr. Satish Varpade sir on the dais.
May I request the guests to please acquire the front seats. Thank you, sir.
Yes, good morning. Good morning. Yes, that's like a real pharmacist. All are pharmacists, na? Would be pharmacists. Okay? So, today's guest, Mr. Anand Mote sir, Prashant Danekar sir, all the guests from so many colleges, their principals or faculty members, all the students from various pharmacy colleges, my staff members and my students from Lotus Business School. I, Dr. Satish Orpade, personally as well as on the behalf of our trustee members, our management council members, Dr. Charudatta Bodankar sir, my staff members, all teaching, non-teaching faculty members, I welcome you all in Lotus Business School. So, I know that our program is somewhat late, maybe 30 minutes late due to congestion in traffic, and so many of your friends are, again they are stuck up in traffic and they are coming. So no problem, we will start our program because show must go on. Why this national conference is, or why we are here? As many of you might be from last year of your pharmacy, maybe from third year or maybe second year students. Okay? Why? And I really congratulate you all because you are eager to know what is going on in the market and what will be the future careers in the pharmaceutical fields. Before some time, we were discussing amongst our, guests that at that time, when we passed our pharmacy or when we entered in pharmaceutical, corporate world or in pharmaceutical world, the world was totally different. I entered in pharmaceutical, career. I started even after completing my B.Pharm and MBA. I started my career as a medical representative. I work as a medical representative for more than 2 years. But right now you are having n number of opportunities, those what are evolving in the corporate world. N number of opportunities. There are so many opportunities that even what you have not thought about that. So this is a very good opportunity to know various things, what are happening in the market, what are going to be, in the future, what will be the careers you may enter in, or the students, those who are in final years, they might have already thought about that, or they have decided about the careers, what maybe right now you are knowing about the only words, maybe blockchain. You might be knowing this word, or maybe you are having some curiosity and gone through this, what is blockchain, what is AI, what is all the things going on in the field of combination of pharmaceutical plus computer science, because that will be the new in thing in the pharmaceutical world. That will be the combination of your domain knowledge as a pharmacist, the pharmacy knowledge, and the domain knowledge of IT, or the working knowledge of IT, or maybe some software knowledge about the IT, and how you can combine both the knowledge. And on the top of that, on the top of these both the knowledge, you must have the management knowledge, because in the future, in the starting or in the lower or at the entry level, you require more about the technical knowledge. And as you reach on the top, or as you started your career, maybe after 5 years, 10 years, 20 years, you must require the management knowledge. So these three combinations you will have to do in the future: pharmacy knowledge, which is your technical knowledge, then your IT knowledge, because you all must have, smartphones with you. Maybe most of you are using Chat GPT or all the latest technology. You must be knowing about that. And maybe in your day-to-day life, maybe in your assignments, maybe even in your submission, you might have you may be using the Chat GPT. How many of you using Chat GPT for doing your assignments? Few of you. But in near future, all will going to use the Chat GPT and all the latest technologies. So you must know all these things. And during, this I always speak with so many people, and always, appreciate that this generation is very blessed, because you are getting all the things which at our generation, what we received that thing maybe after graduation, maybe or post-graduation, or maybe after, we were just discussing the first flight, what, that flight was after the age of 25. So these are the things which you are getting, but at the same time, you will have to be a very, curious about your future, because at our generation, generation changes in 15 to 20 years. Technology, TV technology, we used to watch black and white technology, black and white TV. It takes 5 to 10 years to convert to a color TV. It takes 10 to 15 years to go on internet. First Yahoo email, maybe after 10 years. But your generation have to face a very, very, very tough competition. Because in every 2 years, the technology is going to change. Everything is going to be disrupted. Geo, that's the example, that it changed each and everything. जियो पूरा चेंज कर दिया ना, फुकट में डाटा मिला, फुकट में कॉलिंग हुआ, तो एवरीवन वाज ऑन पूरा वी आर डाटा कंज्यूमर्स राइट नाउ. पहले हमारे टाइम पे मे बी 1 GB वाज दैट वाज द लग्जरी फॉर अस. 1 GB लग्जरी था. नाउ 2 GB 5 GB अनलिमिटेड डाटा. ओके, सो दीज the facilities you are getting with this technology and all these things, at the same time, you will have to face the competition also. Because the same thing is getting to your competitors also. The things which you are getting, the same thing is getting to your competitors also. And the person who is going to use that technology in a good way, in a proper way, he is going to excel. So that is a crux of, future, to secure your future, to use this technology. That's why this theme is a national conference on navigating innovations and career paths in pharmaceutical industry. Because there are n number of innovations as going on. As we are from pharmaceutical field, there are n number of innovation going in, research, maybe in production, maybe in supply chain, maybe in the way the doing the market, maybe in the procuring raw materials, maybe doing the so many things. So you must know that, and that's why this theme is for this year. We regularly yearly do this national conference, and I'm happy that more than 350 or 400 students already registered for this national conference. And this shows that you all are interested in knowing the things what are happening in the market. So once again, I welcome you all in the Lotus Business School. So Lotus Business School is the management institute. We are providing MBA in pharmaceutical and healthcare management, PHM, pharma and healthcare management. Beside the HR, marketing, finance, you must be knowing all these things. And we our tagline is innovating business leadership. Means we always try to do new things in the Lotus Business School. You might be knowing, or you may not knowing about all these things, but we always try to innovate something differently. For this year, we are again try to innovate ourselves. Last year, 2-3 years, we tried to innovate ourselves through the CPP models. We provide, regularly our MBA syllabus from SPPU, Savitribai Phule Pune University. Along with that program, we provide 10, modules to all these students which are latest happening in the market. Besides that, we provide 1-year internship in the second year, because we believe that on the job and off the job, classroom training and industrial training both are required for your future. But the coming year, we are thinking about the paperless college. The new thing which we are thinking, the paperless college, because we are starting a new program from this year. We are starting PGDM, Postgraduate Diploma in Management, in Pharma and Healthcare Management, along with Agribusiness Management. And for that, we are thinking about the paperless college. Will we able to do that? What do you think? Paperless college. You need not to take any notebook, you need not to take anything, you need not to write your answer sheets also, because examinations and all these things, that will be online only. So let's see how we can succeed in that paperless college. So there are so many a number of things, innovative things we try to do in Lotus Business School. And we believe in one formula in Lotus Business School, KSAEE. That is our philosophy. That is our philosophy of Lotus Business School. KSAEE. That stands for K for knowledge. Maybe online, offline, from book, from SPPU syllabus, through various our CPP programs. K, S for skills. So you must be watching, our students are doing all these programs. So they are involved in each and every steps from planning to execution. So they are getting the skills, how to handle the program, how to evolve their skills. Then KSA, that is the major challenge to all the institutions, that is the attitude, A for attitude. Because we can understand the attitude of the students, we know each and everything. We are having Google with us. What you are telling, already we know that. But you will have to, there is saying that there is a difference between the information and knowledge. Information you can get anywhere. But knowledge, you will have to implement that information for getting the solution. So that is a knowledge that you will have to work on that. KSAEE, E for exposure, exposure to various things. Right now you are exposing with the new latest trend, what is going to be in the market, that is exposure. And through our various programs, we try to give the maximum exposure to our students to the real world, real competitive, real what is happening in the reality in the market. And next is experience. Experience through the various programs. So maybe our Junoon, our flagship program, we do this Junoon program on the basis of the IPL. IPL के जो पूरे the steps होते हैं from auction to getting students and managers and all these things. So we believe in that. So through that formula, this our small try to give you the exposure and the real knowledge about the pharmaceutical world. So hope that after completing this program in the evening, might be we can try to germinate seed in your mind about your career. Either we can provide you the knowledge about the various things, what is happening in the market, what are the innovating things, what are going on, and that maybe create a thought process in your mind, and you can adopt that thought process and you can implement that thought process, and you can try to do your career in that domain only. So once again, thank you all for coming this national symposium or national conference, and thank you very much all my committee members for giving me the opportunity to discuss all with you, and thank you very much.
Thank you, sir, for sharing your valuable thoughts and also enlightening us all by giving some light on the various career opportunities in pharma industry, as well as how the market is using the advanced technologies and how we should adapt it by applying the paperless college concept. So I'm sure that your speech was a source of inspiration for all of us. Thank you, sir, once again. Now it's my honor to introduce our esteemed guest, Mr. Anand Mote, sir. Sir has completed General Management, Strategic Marketing and Finance from renowned institute, that is IIM Kolkata. Sir is a management professional with 25 years of proven record in hospitals, pharma and consumer healthcare businesses across world-class Indian and transnational organizations. He is currently working as a cluster director at Manipal Hospitals. Also has worked at Kaveri Hospital as a regional chief operating officer in Bangalore. Sir was associated with various healthcare industries such as Sahyadri Hospitals, Aster DM Healthcare, Medanta Hospital, Nova Medical Centers Private Limited, Columbia Asia Hospitals, and Allergan India Limited. Sir's key strength is ability to align insights with business strategies to deliver results. Being a self-starter with an intent to make a positive difference, Sir is a strong proponent technological advancement for business transformation. Sir, now I invite you to share a few words about the significance of Pharma Summit and the countless opportunities it presents for aspiring professionals in pharmaceutical domain. Please, sir.
Good morning. Thank you, Dr. Satish, Mr. Vivek Keskar for inviting me, and Mr. Prashant, it's great to know you. And you all are pharmacy students, right? My voice is echoing, or you are able to hear on the last side, last bench? Okay. So thanks. She actually read my LinkedIn profile, So I was laughing to myself and saying how technology has actually, helping us in all the way. Mr. Vivek was talking to me and I was busy. I couldn't send him my details. I said, sir, please take my details from LinkedIn. He, gladly did it. So I'll just start by saying as to what my career, how I started. I was aspiring pharmacy student like you. I did my B.Pharm from Pune College of Pharmacy. Post that I did my management graduation from Pune University, and that IIM course I did in 2007 and 8, because as a career progress, you need to innovate and you need to learn new things, because whatever you learned yesterday may not be relevant today, and whatever you learn today may not be relevant tomorrow. Sir also mentioned that the way innovation is taking place, the faster pace it's Hello. Yeah. It's technology again. Okay, so the way I look at my career, I didn't make any presentation. I just wanted to have a very interactive chat, because for me it was by, I would say by luck, or the way I would like to put it, this kind of career was never planned. I started my pharma, I regularly started with my pharma, eventually my organization felt that I have some kind of skills that I can work in varied industries. So I worked in consumer healthcare industries, I worked in FMCG company, and then opportunity was opening up for healthcare industry, and I started working for hospitals, right? So this is the career progression which has happened then, because the time when we started our careers, we didn't have abundance of information which is available now. And all that you have is kind of knowledge. He mentioned about Google. Forget Google. You all know about with your peers, because the way education is transformed everyone, the way information is available, you know your choices. And that's where I think we need to really focus. Because when you didn't have information, you didn't know sort of what to do, you were navigating your way, saying that, okay, I do this, then what is next for me? That is coming from a self-learning, self-experience. And there was a very little guidance which is available. Now that you have information, you have guidance, you have various examples in front of you, all that you need to do be very focused in terms of specifically what you want to do, and that's what industry look at you. When you come out, when you finish your graduation, when you saying that, okay, now what is that I want to choose for my post-graduation? Which business school do I go to? What course do I choose? The generalist things are gone. When we were finishing, or we have a general MBA, you saying, okay, you're finishing general MBA with typical course curriculum. Now, is that important? When as an industry expert, it may not. Because then when you go for your next level of, after you completing your education, when you go into industry, all industry wants is that what specific that what specific you bring to the table. Even sales and marketing now, division of marketing has gone into whether digital marketing, whether it's you understand sales, whether you understand dealership, whether you understand distribution, whether you understand supply chain. These are the things which actually industry look at you. So when you go into your next phase, and that's where I think I like to congratulate Mr. Keskar and Dr. Satish, is that this kind of thing is very important. Pharmaceutical management course, because general MBA may not help. When you come to this kind of business schools, or probably they will talk to you specifically about what's happening in pharmaceutical industry, and that's what industry will look at it, right? So I'll just briefly run you through in terms of what kind of career options are available in a healthcare industry, right? And pharma is just part of it. When we started, I was just speaking to sir before this particular function began. When we were finishing 12th, there's options of engineering, medicine, and if you miss this, then you probably have allied courses are there. Now look at you. You have huge career options. I mean, before I come to healthcare part, you have multiple career options. People are making careers out of things which are unrelated areas. You have an engineer starting on a fintech company. You have someone like school dropout or college dropout starting company called OYO, and you have people, engineers who studying abroad, coming back in India and starting Flipkart. Was that possible in our era? Probably not, right? So while you are pursuing your careers, please keep in mind that you can do anything. The humongous opportunities are available. Wealth of information is available, and there's no way that anything can stop you. So that's a first and foremost. That first you need to understand. Now, having chosen healthcare as your option, so what are the things available? So when actually you get into anything, there is two things I looked at it. I was talking about specifics, so that is called as a core. If you're saying that I am a pharmacist, I've done my graduation in pharmacy, I've done my MBA in pharmaceutical health management, I will choose my career into pharmaceutical. That becomes your core, right? That means you have domain knowledge, then you are acquiring knowledge which is specific to your domain, and you're working in industry which actually relates to that. That becomes your core. What could be generalistic? You have done pharmacy, you've done pharmaceutical management, and you suddenly start working into an unrelated industry. Is that possible? Quite possible, right? But then, coming back to what I again mentioned in terms of specificity, because then when you actually, your knowledge and your domain knowledge and your education, you combine together, you will be able to have a better possibility of success. Now, having said that, I don't want to influence your choices, but then I'll tell you as to what are the things which are available quickly, because then that's where I think you would know that there's a humongous opportunities available within healthcare industry itself. Back to when I graduated, I only know pharmaceutical industry, and there was a friend of mine, she did some program in hospital and healthcare management, and we were laughing at her. I said, come on, I mean, in Pune at that point in time, you had hardly a couple of hospitals which were of repute which were available, right? I mean, nobody would thought at that point of time the healthcare industry would be so big in India. It's actually huge. It's 10 or 12 times if I go by numbers compared to pharmaceutical industry in terms of size, and it is more and more getting professional. So what had changed? It changed that there are so many things which were not seen that point of time, had shaped up a new industry which was not envisioned that point in time. So now coming to healthcare, there are healthcare broadly, the way we look at it, as to now I'm working for a hospital. Hospital is a healthcare service. So you have healthcare services, and then you have a product industry, you have healthcare fintech, where you have healthcare insurances. So these are the broad areas which are available right now for each of you to choose when you actually finish your careers. Now coming back to healthcare services, you have large hospitals, and trust me, this industry is revolutionizing. At this point of time, this is developed, but there's a huge scope. Imagine the largest corporate hospitals like Manipal hospitals, where I work for, is available in the bigger cities. But you have a larger tier 2, tier 3 cities, smaller cities, where healthcare corporatization still yet to take place. So that means that kind of opportunities are available. And what are the scopes for a pharmacy graduates there? You have a large pharmacy chains which runs into hospitals. You have a careers like me, which I've done, which is available for a healthcare institutes. So that's about healthcare services. Healthcare services are other aspect like a diagnostic companies. You must have heard of Lal Path Labs, Thyrocare. You know, these are the diagnostic companies which are available across the country. And then there's a large career options which are available on that side. Retail pharmacies. You know, you probably were wondering, those retail pharmacies are brick and mortar, as in physical pharmacy, as well as you have e-pharmacy. So those kind of options which are available. Now, in pharma, I think sir may talk to you more details. In pharma, when we started our careers, we have just only a couple of options. You either go into productions, you go into sales, you go into marketing, and these are the options. Or some of more learned would go into regulatory affairs. So these options which one would have that point in time come now. What difference? Even the way you would do your sales job itself has changed because of availability of e-pharmacies, availability of a lot of retail pharmacies, availability of sales opportunity in the hospitals, availability of opportunities into selling your products into those aggregators. The way marketing has changed. When marketing, you have a digital marketing, it's come in a big way. You have marketing to different segments, which has come in a big way. So eventually, all these things which is shaped up the way you talk to your customers, you talk to your patients, you talk to, in coming back to hospitals, the way we talk to our patients, the way we treat our patients, the way hospitals are, the whole thing has changed very big way from what we used to do. Now, in terms of e-pharmacy, I mean, I was talking to certain friends in terms of what the way they used to talk about sales. They used to have distribution, and now what has happened? You have big industries coming up in terms of aggregators, the pharmacies which actually buy, and then for something like a hospital, you have a large distributors which almost helps you in terms of getting all your supplies. So these things have considerably shaped up your career options which one can have. And regarding hospitals, do I need to talk about hospitals? Hospital industry, when we started, was a just simple plain industry now which has grown, which is a multi-billion-dollar industry. Hospital has a careers for pharma people in terms of the way sales and marketing can be done, the way they run e-pharmacies, the way they run hospital pharmacies. And hospital pharmacies essentially, is something which actually, sorry. And the careers in terms of the way I'm managing the hospitals. So these are the sort of career options which are available for most of you aspiring pharmacists who will acquire a pharmacy knowledge and get this MBA knowledge and then start exploring your career options in the industry. So some of these my thoughts around this. What I would like to do is, in case you have any questions, you may kind of, I think I'll do more interactive, get more questions in case you have, and then probably that will make it more interactive. Yeah. Okay. So as I mentioned, see, I worked in pharma for some time. I worked in pharma sales. I moved into pharma marketing. Then I spent some time into industry as a consumer healthcare products. And around that time, we realized that there's a change which is happening in terms of more hospitals are coming up as a corporate hospitals, and corporate hospitals is where I started my journey as a corporate hospital sales executive. And from there I moved into operations, and then I become someone who can manage the hospitals. Right.
Morning, sir. I'm Subhash Shinde from Sanjeevani College. Sir, I have already published some research paper based on survey. I collect data from participants in Google Forms and build a analytic chart and I have published the survey paper. I have also published few. I have also authored some books also which are available on Amazon. So I need to know how this data management can help me in growing, building my career in pharma.
Yeah, I think, see, that's one aspect I mentioned, missed out is in terms of analytics, data analytics, and because most of this organization, you're talking about basically data management, right? So data analytics and data management is becoming a big career option, because currently with available of huge data, one need to classify what kind of information somebody's needed. And that's where data analytics companies are coming up in a big way. Data analytic companies help very accurately in terms of decision making. For someone like me, if I want to have some decision, to make, then you have multiple kind of information which is available, which can slice in a different way using either technology, whether using analytical tools, and those information can be utilized, to make a decision. So there's a huge opportunities. There are companies like, if I remember, I was talking to your directors about this company called, say, Integene. Integene is a company, I'll just give you example, which they actually have, gives you for all pharmaceutical sales solution which is outsourced to them. They leverage on technology. They use all research information. They feed the information to many pharmaceutical companies as well as hospitals in terms of any specificity, and that information is available for you to take some decisions. Right. Is that answers your question? No.
So, what are the challenges one will face after finishing pharmacy to enter and secure a good spot in healthcare or pharmaceutical industry?
Yeah, as I told, around that time, we never thought that the kind of competition we have it today. You know, there are very few opportunities, and the competition also was not very large. So challenges was in terms of this. I would say that the kind of information availability now that we have wasn't there that point in time. So challenge was to how do we kind of get information. You know, right now if you Google, you have information available. You research company quickly. You go for an interview more prepared. You know, so while getting into, you don't have that kind of information available. You'll speak to people. You'll speak to someone senior. They are also very few in number. And then probably that makes little tougher for you to have you know, information with you while you enter in an industry. And you have to do your own research. You know, suppose to give you example, if you start a sales job and then you you want to start market your product, you don't have information available. What you'll do is that you'll go across, start getting notes, put information in place, and start your work. So those were different type of challenges. Now what you'll have is you'll have information available with you. You have competition information is available with you. You have everything that you need, but then the challenges for you in front of you would be in terms of how do you perform, how you deliver results, and how quickly you deliver those results. Right. Right. So I think obviously I'm still here for some more time before I go out. In case you need any information, please do reach out to me, because you know, you seems quite you all are bright students. You know, there's a good career lies in front of you. So use these kind of forums to gain knowledge, acquire you know, information that you need, and that will kind of help you as you grow and prosper in your career. I'd like to thank again Dr. Satish for inviting me for these things, and these kind of forums and platforms are always useful for you know, students to interact with people from industry and gain knowledge. Thank you very much.
Thank you, sir. Sir, also we have some questions from the students attending the session on YouTube Live. So I request you to answer them too.
We have a question of students attending this seminar online upstairs. So what is the role of pharma in QAT? This is the first question. The second is regulatory affairs, a future of regulatory affairs in pharma. So these are two questions that we have received online.
So you want to answer regulatory affairs? May I?
Yes, sir. It's online live.
Okay. One thing is for sure, pharma is equal to regulation. So wherever and for however long pharma is going to be there, there is going to be regulation, there is going to be legal, there is going to be compliance. You go to any good pharma company, these are the three most required, entities. They are the backbone of a good pharma company. So regulatory affairs, yes. And now, interesting thing that is happening is even in COVID, we got the vaccine. Usually for any drug to get approved, takes hell lot of time. Just today morning, I heard somebody saying in Japan it takes 10 years. If you would have waited for COVID vaccine approval for 10 years, Pune would have been vacant by now. People would have been dead. So there also improvements are happening. Drug delivery mechanisms are changing. So regulatory, legal, compliance, these are three very critical teams in a good pharma company. Molecules also are changing. Today and now, for those who are in the floor sitting above, let me tell you one thing. The era of medicine is now changing. Now we are also talking about digital health. So even in US FDA, they are changing themselves how to handle digital health. And next 5 years, by the time this generation is ready with MBA, you will all be talking about regulatory affairs in digital health. How do you give approval for a digital drug? Don't know. So it's all evolving. Even the DCJ doesn't know right now. But it will be a big requirement, big, huge.
Right. Thank you, sir. I hope Shivraj, who has joined online, has received his query. Right. I request the anchors to proceed.
Thank you, sir, for giving us the knowledge of healthcare industry. Sir has also told us that how easily available information and education has transferred us, and all of we can upgrade and succeed in our career. Thank you so much, sir. Now, I feel privileged to introduce our next guest, Mr. Prashant Danekar, sir. Sir has complete certification course in Advanced Strategic Marketing from IIM Kozhikode. Sir, currently working as a Director Patient Support Program at HDU Healthcare at Mumbai. Sir also have work experience with Dr. Reddy's Laboratory as a marketing head. Sir also work at Vocard Limited as a General Manager in Marketing. Sir also work experience in Alchem Laboratories Limited. Sir joined as a Senior Product Manager and promoted as a Marketing Manager. Sir has vast experience with renowned healthcare industries like Zuventus Healthcare, Ecom USA, Johnson & John, Ion Exchange Invro Farms, and John Wealth Limited, Mejda Marketing Private Limited. Sir having diverse skill set, which means having expertise in healthcare marketing and sales, therapy development and management, P&L management, business development, brand management, and team management. I am honored to give information about Sir's accolades. Sir gained first rank for Dr. Reddy's in CNS space within 1 year. Sir created a web bill plus program and an app for headache record management. Sir also felicitated with 4 Marketing Excellence Award in Vocard. Sir also earned 4 promotion in Alchem Laboratories and 3 promotion in Zuventus Healthcare. Now I request Mr. Prashant Danekar, sir, to address gathering and share his view on looking at healthcare beyond the pill. Please, sir.
Good morning. Good morning, sir. Am I audible? I can speak like this for next 2 hours, no problem. I'll take. Okay. I'll take. Good. Okay, first it's my privilege to Done? Hello. Yeah. Audible? So I was like wondering what to talk today. Talking to young generation, which is probably, if I'm not wrong, how many of you are pharmacy? I'm a non-pharmacy. So first clarity. Okay, so a non-pharmacy speaking to a gathering of, if I'm not wrong, what I'd heard was 330 pharmacy students who have registered. So I should congratulate myself that I'm speaking to pharmacy people. So please don't talk to me about pharmacokinetics, dynamics. नहीं आएगा मेरे को, छोड़ दो उसको, ठीक है? So what we will do today is, I have spent 30 years in this industry, in pharma. pure pharma. Okay. And by God's grace, 15 years I've been in sales, 15 years I've been in marketing. तो अगर देखा जाए इंग्लिश हिंदी मराठी ऑल ओके ना, ठीक है. सो अगर देखा जाए तो आई सीन बोथ साइड्स ऑफ द कॉइन. सेल्स इज अ वेरी टफ जॉब. इट्स लाइक द फार्मर. अभी बाहर टेम्परेचर कितना है पता नहीं, 35 36. मे इट विल बी 45. नागपुर इट विल बी 50. राजस्थान गॉड नोस. And if we go to Kashmir, it will be 1. The salesperson has to work in a different temperature. Marketing is a funnier job. We work in an area which is this much, but we control entire India. So our challenge was how to control 3,000 kilometers. In sales, you have to control this area. In marketing, you have to control the entire country. So I've seen both sides of the coin. Sales and marketing have, in these 30 years, what I have learned, I'll try to share today. But more importantly, what I'll share with you today is what is going to come in the next few years. Rather, already started, is coming. And by the time you people complete your MBA, probably 2 to 3 years down the line, Bill Gates को पता है. Who's this guy heading Google? Pichai. Sundar Pichai. वो generative AI and Gemini और इधर ChatGPT कुछ एक लेके आएगा. Things will change dramatically in next 2 to 3 years also. Okay. So today I'm going to take you through a journey which is going to come. So if you see, what is the topic? Looking. So emphasis on beyond. I'm going to take you through a journey. थोड़ा सा Star Wars भी है इसमें. थोड़ा स्टार ट्रेक भी है और थोड़ा फ्यूचर भी है. ठीक है. कैन आई गेट अ स्लाइड चेंज? आई हैव अ स्लाइड चेंज हो गया. नेक्स्ट. ओके, हाउ मेनी ऑफ यू आर कंफर्टेबल विद दिस? सब पी, फार्माकोडायनामिक्स, फार्माकोकाइनेटिक्स, and with the goal of becoming pharmacist. So आपके लाइफ में पी का बहुत बड़ा रोल है. ठीक है. When you do your MBA, क्या आने वाला है आपके हिसाब से? When you do your MBA, क्या आएगा? How many of you are aspiring to be an MBA? फार्मेसी के बाद करना है कुछ? बी फार्म के बाद क्या करना है? MBA, M फार्म, maybe M.Pharm, maybe MBA, right? Okay. What is the next thing you will learn when you go to MBA? इधर भी P है. These are all defined by Kotler. Product, price, place, promotion, और भगवान जाने क्या क्या आने वाला है. Okay. So here also there is a P. You learned 3 P's over there. Welcome to the world of 4 P's when you start your MBA. So 3 plus 4, 7 P. You're already in a city whose name also starts with P. Pune. और जो एरिया में उसका भी नाम P है, पुनौले. ठीक है? So we are in that thing. Now when you go to the next future, what I'm going to take you through is today going beyond that 1 P which is the pill. How many of you have heard this concept of tracking patients' progress? किसी ने सुना ही है? Any of you had a COVID patient in your relationship or family? किसी के इसमें हुआ है? क्या हुआ था? वो 14 दिन ना, 14 या 21 days? How many days? What was happening? वो रेमडेसिविर वगैरह वो चल रहा था, वो सब छोड़ दो. वो टोसिलिजुमैब, रेमडेसिविर. आई वाज पार्ट ऑफ अ कोविड कमिटी इन डॉक्टर रेड्डीज. तो वो सब होता था. एवरी आवर देयर वाज मॉनिटरिंग. वन पर्टिकुलर फैक्टर विच वाज SpO2. सो देयर वाज ट्रैकिंग. ओके. अभी का जो जनरेशन आ रहा है ना, इट इज ऑल अबाउट ट्रैकिंग, विच अ वर्ड विच इज बीइंग यूज्ड नाउ इन लॉट इन हेल्थ इज मॉनिटरिंग. ओके. अभी ये फार्मेसी में ये मॉनिटरिंग कहाँ से आ गया? It is not pharmacy, it is now come into health. Sir is from a renowned hospital called Manipal, India's largest hospital chain. Patient of diabetes, diabetes का patient एक आ गया, one patient, he starts today, you have to monitor him for not 1 month, not 2 months, not 3 months, it is for years. So there is monitoring. Okay, so tracking, monitoring is all going to become a part of life now. So a new world is now coming. ये word सुना है क्या? Digital health. By the time you people complete your pharmacy, you are looking out for jobs, you are कुछ नया अपना करने का चाह रहे हो, ये आ चुका होगा, आ रहा है already. Okay. There are different terms. One term is digital health, the other term which gets used is e-health. E-commerce, we say e-health. The basic advantage with digital health is it is enhancing healthcare delivery. How many of you got vaccinated in COVID? Appointment कैसे मिला था? Digital? Certificate कैसे मिला था? वैक्सीन सेंटर पे पहुंचा है कि नहीं पहुंचा है, कैसे पता चला था? वो सेंटर का वैक्सीन खत्म हुआ है, वहां वैक्सीन चाहिए, कैसे पता चला था? ऑल ऑनलाइन. एंड जस्ट इमेजिन उस टाइम पे इस देश में 140 करोड़ लोग घर में बैठे हैं. एट दैट टाइम वैक्सीन इज रीचिंग सेंटर्स. ठीक है, फ्रॉम सीरम इंस्टीट्यूट पूना, वी कैन क्लैप फॉर सीरम इंस्टीट्यूट. एंड द अदर वन फ्रॉम हैदराबाद, आई थिंक कोविशील्ड. एंड so look at the efforts. Okay, now look at the funny part. This was said by Narayan Murthy sir himself. That was a time when everyone had to wear mask, and किधर भी गए तो सर्टिफिकेट दिखाओ, एयरपोर्ट गए, बस स्टैंड गए, किधर भी सर्टिफिकेट दिखाओ. Mr. Narayan Murthy, I think was somebody I read about him. He'd gone to US or UK somewhere with a son for a lunch in a restaurant. The certificate दिखाओ. So his son's certificate was a printout because that government did not issue digital certificate. Mr. Narayan Murthy gave a certificate which was online. India was the only country which gave online certificate. Now look at the power of digital health. 200 करोड़ वैक्सीन पहुंचाए गए, 140 करोड़ लोगों को सर्टिफिकेट. I don't know how many people took the vaccine, but all got certificates. And certificate कितने देर में आता था? Within some time of your second dose, if I am not wrong, or first dose. Sorry. This is the power of digital. By the time you people are through with your pharmacy, your MBA, your M.Pharm, ये आपके life का part बनने वाला है. Take it for granted. ये बाबा कौन जानता है इसको? How many of us go to Google, मेरे को आज फीवर है, मैं क्या करूं? How many of you do it? I'm having what? Sore throat. Google. I don't know, मराठी translate होता है. So, मी काय करू? Google says तुम्ही काही पण करा. Okay, and they will give you some medicine or something, I don't know. But is it reliable, not reliable? I don't know. But in this whole chakkar, we have created something called the Google Doctor. And the funny part, Google gets every minute 70,000 questions on health. Every minute, just count the number of minutes in a day, number of days in a year. That many questions they get. Yesterday I read about Google's this factor. They get 5% of their questions are only on health. कोई पूछ रहा है फ्लू के बारे में, कोई पूछ रहा है फीवर के बारे में कोई पूछ रहा है, वैक्सीन कोई पूछ रहा है, मेंस्ट्रुअल हाइजीन कोई पूछ रहा है, पीसीओएस कोई पूछ रहा है, कैंसर कोई पूछ रहा है, हाइपरटेंशन. Now this is creating one problem which sir can tell me. When you go to a hospital, patient is already reading Google and going to doctor. अभी आप imagine करो, you are a pharmacist, you are giving some medicine, your patient is going to ask you, sir इसका side effect बताओ ना. Google. But इसका एक problem है, all these people are half cooked. पूरा knowledge नहीं है. But जिसका दिमाग खा रहा है, he has spent 8-10 years. So please understand, you are going to face this praja a lot. When you complete and you actually go into the world, is still okay. The next one is wonderful. WhatsApp pe how many in you have family groups? Senior citizens? Do they pass diabetes साठी असं करा? Okay, मेथीचं औषध घ्या. Hypertension साठी तुम्ही योगा करा. Everything on WhatsApp. Is it certified? Then on this basis they will ask the doctor. Now tell me one thing, is this right or wrong? Somebody was asking on YouTube, regulation, ये सब regulate होने वाला है. Because see, this is going to hurt people. Wrong information ना. अभी COVID के time पे, I was part of the COVID committee. I was with Dr. Reddy. That time we were handling this vaccine called Sputnik. So we used to get questions. Covishield लिया है तो Sputnik चलेगा क्या? Covishield लिया है तो Covaxin चलेगा क्या? तो ये सवाल आया कहाँ से? It has all come from WhatsApp and Google. Now, is this digital health? My first question. Is this digital health? No or yes? How many of you say yes, it is digital health? I say it is digital health. Platform digital है ना? Platform digital है. How many people are aware about Google? अभी तो कोई होगा ही नहीं जिसको पता नहीं. Everybody is aware. How many people are aware about WhatsApp? सुबह पहले उठते गुड मॉर्निंग आता है. So everybody is into WhatsApp. Now is this digital? This is digital, but this is deadly also because you are creating something negative also. So when you people are through with your studies and this, please be aware, ये एक अच्छा चीज भी है. This is going to also be a trouble for you because half information. Today I'll take you through 3 journeys. What is the evolving disease landscape? What is the global digital health? क्या चल रहा है? Okay, and what's happening in our country? Because at the end of the day, आप बोलोगे सर जॉब किधर है? बाहर है, इंडिया में, बाहर कहीं भी जाओ, you'll get good salaries, no problem. Okay, coincidentally, I am not working for any company to promote anything outside. Okay, first disclaimer, I am not an IT expert. I am a pure pharma guy. I am taking you through a journey which is going to be an exciting journey, but I am not an IT guy. I am a pharma guy. Okay, so I'll take you, I don't know how to translate in Marathi. हिंदी में बोलते हैं ना, बहती गंगा में हाथ धोना अच्छा होता है कि बुरा होता है? इजी होता है कि डिफिकल्ट होता है? बहती गंगा में, वाहत्या पाण्यामध्ये आपण म्हणतो ना, इट इज इजी टू. सो प्लीज अंडरस्टँड वन थिंग, व्हेन यू आर मेकिंग युअर करियर्स, नो, अंडरस्टँड व्हॉट आर द ट्रेंड्स. इट विल हेल्प यू. आई एम टेकिंग यू थ्रू 3 such trends. Thank you. Any idea, you're all pharmacy students, right? अभी कौन सा disease चल रहा होगा? Which disease is very prominent? Huh? Diabetes. The time when I started my first job, no? Diarrhea. 91, diarrhea. 2000 आने तक कोई पता नहीं था, सिर्फ डायरिया फीवर ये वो सब. Now we are talking about diabetes. We are also talking about one more word now, depression. Times are changing. Okay, so with this changing times come changing opportunities and changing business models. ये कभी सोचा है इसके बारे में? हम लोग बोलते थे कि हमारे घर में जब हम थे उस टाइम पे ना, दादा दादी नाना नानी पार्ट ऑफ हाउस, दे आर नॉट इन पार्ट ऑफ आवर हाउस टुडे, दे आर लिविंग सेपरेटली. अभी का जनरेशन, दादा दादी साथ में नहीं रहते हैं अभी, दे लिव अपार्ट. बट ये पॉपुलेशन बहुत बढ़ रहा है. बाय द टाइम टुडे 1 out of 8 persons are old. इसका मतलब क्या है फ्रॉम अ फार्मेसी पॉइंट ऑफ व्यू? 1 out of 8 person is old. Old means 60 plus. What is the meaning? What are the requirements of old people? कोई सोच? क्या क्या बीमारियां हो सकती है? बोलो बोलो. What type of बीमारी या डिसीज ओल्ड पीपल मस्ट बी हैविंग? घर में है दादा दादी नाना नानी, क्या है उनके प्रॉब्लम? अल्जाइमर्स, ओके. बीपी, ओके. सो आई गिव वन फनी एग्जाम्पल. कभी सोचा नहीं था हम लोगों ने, 91 में मैं बात कर रहा हूं, कि डाइपर आएगा. डाइपर, दैट टाइम बच्चों का भी डाइपर नहीं था. फिर पैम्पर्स एंड ऑल केम, एंड नाउ लास्ट 5-7 years वी आर सीइंग अडल्ट डाइपर्स. ये कौन से फार्मेसी में सिखाया गया है? नहीं है, बट ये अपने आप में एक बड़ा मार्केट है. डाइपर्स. डू दिस पीपल नीड वॉकर्स? There is one more problem now. Pune is IT city. The old family is living here, husband, wife, और बेटा बेटी किधर है? They are lonely, depression, Alzheimer's. So ये एक पूरा नया दुनिया आ रहा है. So if you are looking at yourself from your career point of view, no, please look at this window. क्योंकि इसमें जितना भी तुम पढ़ोगे, आपको पता है अभी ये नर्सेस लगते हैं, नर्सिंग ब्यूरो सुना है कभी? हमने पहले नहीं सुना था. अभी नर्सिंग ब्यूरो, दे चार्ज यू 45,000 rupees per month. 45,000 rupees per nurse per month. फिजियोथेरेपी चाहिए घर पे, एक फिजियोथेरेपिस्ट 700 rupees per 1 hour. So this is a total different world which is coming. होम लैब आता है क्या? घर पे आता है लैब, diagnostic lab. So this is a new business which is now coming. When I left Pune 17 years ago, परांजपे का एक स्कीम आया था फॉर सीनियर सिटीजन पे घर लेने के लिए. अभी जब देखता हूं गूगल पे, there are more than 50. This population is growing. ये वर्ड सुना है क्या? You're all from pharmacy. Have you heard the word called non-communicable disease? Non-communicable diseases today are killing 70% of the people who are dying. Diabetes, hypertension, cancer, mental disorders and respiratory problems. आगे जाके आपको करियर बनाना है ना, तो ये 5 में से कोई भी एरिया में अच्छे से फोकस करो, आपका लाइफ सेटल्ड रहेगा. I'll give an example. You people must be following pharma companies, right? Sun Pharma किसको पता है? किसको पता नहीं है? मेरा अच्छा शेयर है उसमें. 1983 this company was launched. 1983, okay, by Mr. Dilip Sanghvi. उस टाइम पे he was the first person in Indian pharma to launch medicines for diabetes, neurology, psychiatry, cardiology, gastroenterology. इन्होंने वो रास्ता चुना. तब सब लोगों ने बोला क्या पागल है. आज देश के सबसे अमीर लोगों में उसका नाम है. नॉन कम्युनिकेबल डिसीज. लुक एट सिप्ला. सिप्ला इज नोन फॉर इट्स इनहेलर्स, respiratory problems. Diabetes, Novo Nordisk, Eli Lilly, big names today. So mental health में Sun Pharma, Intas, they have gone way ahead. ये एक नया प्रॉब्लम तैयार हो गया है. ये रूम में कोई है क्या मेरे जैसा मोटा. This is a big problem, no? Serious problem है ये. 1 out of 8%, 1 out of 8 people are fat now. 1 out of 8. Obese person का problem क्या क्या होगा? Diabetes, thyroid, PCOS in females, hypertension, भगवान मालिक. ओके कितना ये येलो में क्या लिखा है? 4 time increase in 30 years. Just 30 years. 100 crore people have become fat. अभी इसको धन्यवाद किसको देने का? मैकडोनल्ड्स को देने का? I leave it to you. Now इसका ब्यूटी देखो. How many of you have heard of a company called Novo Nordisk? One, only one. Diabetes का राजा है Novo Nordisk. Okay. They launched one medicine last year और उसके पहले if you have heard semaglutide. फार्मेसी में पढ़ाया गया मॉलिक्यूल semaglutide. इतना इम्पैक्ट किया कि Novo Nordisk is from Denmark. Okay. They turned a negative growing country into a positive growing country with just one brand launch of semaglutide. Wegovy करके brand देख लो गूगल पे. WEGOVY. That is the power of a pharma brand. और एक चीज मैं आप लोगों को बता दूं, कोविड का फर्स्ट फेज कब आया था? मार्च 20. आई हैव बीन वर्किंग इन फॉर 30 years, बट उस टाइम तक हमको कोई अच्छे से बात नहीं करता था हमारे साथ. डॉक्टर, रिसेप्शनिस्ट, केमिस्ट, nobody used to talk. The moment COVID came, we all became Raja. Okay, healthcare has become a very promising industry now. Okay, but एक requirement रहेगा आप लोगों के लिए, try to be innovative. Routine follow करोगे तो you will get your typical job, but कुछ innovative करोगे, you will get a fantastic pay skills in this industry. I have seen people start at 3 lakhs, 2 lakhs, today they are earning 75 lakhs. Reward is very high in this industry. ये एक नया प्राणी आ रहा है. ये वर्ड सुना था क्या? डिप्रेशन, ये सब. टुडे 5 out of 100 people are suffering. So ये 4 चीज आ रहा है. तो अभी ये बहती गंगा है क्या? अगर आप ऐसे किसी कंपनी में काम करोगे या सेक्टर में काम करोगे विच आर डीलिंग विद दीज इश्यूज, you are likely to do very well. Okay, now look at the impact of all these diseases on World Health Organization. World Health Organization ने क्या कहा है कि these are all diseases of the 21st century. So अगर ये diseases को handle करना है, you can't go by the old habits. You have to change. You have to bring in new habits. And one new thing which they are suggesting is digital health. 5 reasons. Distance. आपका कोविड सर्टिफिकेट कहां से आया था? कहां से आया था सर्टिफिकेट? ऑनलाइन आया, वो कहां से आया? बैंगलोर, दिल्ली, पुणे, मुंबई, we don't know. It came digitally. So distance was not a problem. Person in Guwahati also got. Kashmir, Pondicherry, Gujarat, सबका सर्टिफिकेट within time. Distance. अभी cost. Okay, thanks to digital cost. अभी ये lab report does it come on WhatsApp? Suppose I have to consult to a doctor on video call. मैं घर में बैठ के कर सकता हूँ? घर में बैठ के कर सकता हूँ? मेरा ट्रैवलिंग खर्चा कम हो गया क्या? कम हो गया. तीसरा, मोबिलिटी. अभी योर पेरेंट्स आर एट होम, दे कांट वॉक. घर में बैठ के ट्रीटमेंट हो सकता है. दीज आर ऑल द थिंग्स विच आर बीइंग हैंडल्ड बाय डिजिटल हेल्थ नाउ. और ये इसमें Google, all these big guys are playing a big role. So I will say only one thing, it is not changing every 5 years or 10 years, now it is changing every year. अभी चैट जीपीटी था, तब तक समझ में आ रहा था चैट जीपीटी क्या है, उसके आगे आया सारोस या सोरस कुछ तो आया, हाँ सोरा, इट इज क्रिएटिंग वीडियो। वो समझ नहीं आ रहा था, उसके पहले आ गया दो इट इज नॉट वर्क गूगल का जेमिनाई, पता नहीं और क्या क्या आने वाला है, वी डोंट नो, इट इज गोइंग टू इम्पैक्ट। सो प्लीज जितना हो सकता है उतना मेरा एक रिक्वेस्ट रहेगा, इंडस्ट्री में जाना है नहीं जाना है, चॉइस इज ऑल योर्स, बट प्लीज कीप योर सेल्फ रेडी फॉर दिस, बिकॉज यस दिस सेक्टर इज गोइंग टू पे यू वेरी वेल। फिलहाल इंडिया में लोग बहुत कम है, इसमें बहुत कम लोग हैं, ओनली वन कॉलेज इज ऑफरिंग अ सर्टिफिकेट कोर्स ऑन डिजिटल हेल्थ, आई एम रायपुर, they are having a diploma 1 year course, I am Raipur. Now I'll take you through global digital health. ये तो means Star Wars, how many of you have seen Star Wars movie? वो मेरे टाइम का मूवी था। Star Trek, नया नया फिक्शन मूवी कौन सा है? हाँ बैटमैन, चलो ये दिस इज ऑल फिक्शन, इट इज क्रेजी, क्या क्या आ रहा है देखो। ये आप लोग जानते ही होंगे ना, ये दवाइयाँ आपके बुक्स में रहा होगा, वैक्सीन 1796, एनेस्थीसिया 1846, जर्म थियोरी 1861, मेडिकल इमेजिंग 1895, स्टेम सेल थेरेपी, एंटीवायरल, ऑर्गन ट्रांसप्लांट, एंटीबायोटिक्स, इम्यूनो, ये सब लास्ट सेंचुरी। व्हाट इज द डिस्कवरी ऑफ दिस सेंचुरी? दिस इज नाउ बिग टाइम। इन आवर कंट्री राइट नाउ थोड़ा मोड़ा काम चल रहा है, वर्ल्ड दे आर वर्किंग वेरी हेवीली ऑन दिस, एंड टेक इट फ्रॉम मी इन राइटिंग, दिस इज 2024, बाय द टाइम 2028 2030 ये इट विल बी देयर। सो अगर आप जितना शुरू करके अपने को तैयार कर सकते हो, योर करियर प्रॉस्पेक्ट्स विल बी ब्राइट। जस्ट इमेजिन यू आर बी फार्म with MBA and certain understanding of this world, आपका life is settled, because this is going to be the future from 2030 onwards. So different roles that are expected, virtual health. How many of you have spoken with chatbots? कभी chatbot से बात होता है? ये कौन है? It's a software, AI, chatbots. ठीक है, वर्चुअल हेल्थ असिस्टेंट, अभी यू आर कॉलिंग अ क्लिनिक, आर यू टॉकिंग टू अ रिसेप्शनिस्ट और आर यू टॉकिंग टू एन एआई? आपको नहीं पता है, कब पता चलेगा? कुछ आप आडातेडा पूछोगे, डेक्कन कडनं मी तिकडून आलो तर कसं येऊ, एआई विल गो वो बोलेगा जाओ कहीं पे वो क्या मिसल पाव खाओ और भूल जाओ। So, all of these jobs are going to be like, I'll give an example. What is the cost of a medicine of cancer? Any idea? Cancer. Very costly? 20, 30, 40, 50, 1 lakh, ऐसे ही कुछ रेट्स है। उसमें fraud बहुत होता है। With all these technologies, they are trying to lock this fraud. How many of you are aware you are in pharmacy? अभी तेलंगाना में क्या चल रहा है? What is happening in Telangana right now? अभी चल रहा है, 2 दिन पहले का एपिसोड है इन तेलंगाना। चॉक पाउडर इन मेडिसिन, जिसने बनाया वो कंपनी भी नहीं है, एंड somebody was asking about regulation from top floor. कौन सा रेगुलेशन? चॉक पाउडर। One brand of the company where I worked, Dr. Reddy Alchem, Clavem, वो भी उधर चॉक पाउडर फॉर्म में बिक रहा है हैदराबाद में। Now what will you do? So all this will be controlled with AI. So when you are talking about regulation, ये सब आने वाला है, and if you ask anybody in DCJ right now, किसी को कुछ नहीं पता है। अभी सब लोग वो भी समझ रहे हैं how to handle this. ये welcome to the first word of digital health, generative AI. What is generative? What is generative? When you type on Google, what happens? Suggestions करते, auto suggestions आते हैं क्या? These are generative. ऑटो स्पेल चेक होता है क्या? होता है. सपोज यू वांट लेट्स से चितळे बंधु पुणे, आपको पता नहीं है चितळे पुणे, जैसे आप चितळे टाइप करोगे बंधु पुणे ऑल दैट ब्ला 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 और पहला आएगा बाकरवाड़ी. क्रिएशन. What this is helping is, suppose I am a doctor, I have come to your place. अभी आपका डॉक्टर का एक काम है डायग्नोसिस, नोट्स लेना है. ही इज जस्ट टॉकिंग, ओके दिस, ओके फीवर कोल्ड 102 टेम्परेचर, ये वो अपने आप टाइप हो रहा है. ओके डॉक्टर को टाइप करने का जरूरत नहीं है. 102 फीवर, 3 दिन से बुखार, ये वो, राइट. सॉफ्टवेयर बैकएंड में उसको करके वॉइस को टेक्स्ट में कन्वर्ट करके हेल्थ रिकॉर्ड में सेट करेगा. By the time doctor goes to hospital, it's in the record. Now doctor का time बच गया क्या? This is generative AI. Patient diagnosis में help करेगा. Okay, how many of you know annotation? Word सुना है? हम लोग ये कौन लोग रेडियोलॉजी में कौन लोग एक्सरे वगैरह करते हैं ना? X-ray, then we have those 2D echoes, ultrasound and all. You have to prepare some notes. And you have to give these notes to the person who is going to see the whole thing. These are all called annotations. ये AI generate करके उसको चले भी जाता है. Read करके AI से annotation create करके goes to that person, the doctor. Okay. Drug discovery. COVID, when did the first episode come? COVID. March, India में, China में, some months before. When did we get our first vaccine in India? Within few months. You are all from pharmacy. Tell me one thing, how much time does it take for a drug discovery? 8 से 10 साल. वैक्सीन कितने दिन में आया? ओके जिसको पता नहीं है उन्होंने क्या व्हाट डिड द पीपल हु आर नॉट नोइंग व्हाट डिड से, इनको पता था ऐसे होने वाला है, उन्होंने वैक्सीन तैयार रखा था. मैं आज मैं बैठा हूं इधर, अभी कितना बजे है? 12 बजे. आज रात मेरे घर पे 25 लोग खाने पे आने वाले हैं. आपको पता चलता है क्या? ड्रग डिस्कवरी इज वन थिंग विच इज गेटिंग बेनिफिटेड. ओके मेडिकल रिसर्च एंड क्लिनिकल ट्रायल्स आर गेटिंग बेनिफिटेड. आपका टाइम बच रहा है. ओके एंड डॉक्यूमेंटेशन. मोस्ट ऑफ यू इन फार्मेसी आर इन्वॉल्व इन द वर्ल्ड ऑफ डॉक्यूमेंटेशन. इट्स ऑल गोइंग टू चेंज विद एआई. ये आपका टाइम भी बचाएगा, पर आपको ये आया नहीं तो आपका जॉब भी खाएगा. देयर इज अ टिपिकल क्वेश्चन राइट नाउ हैपनिंग इन इंडस्ट्री, विल एआई टेक जॉब्स? आप लोग पढ़ते होंगे कहीं ना कहीं. तो somebody who said, I don't know if it will take jobs, but I know one thing, those who will know AI will take the jobs. So आपको थोड़ा बहुत भी आता है, कुछ आता है, when you do your B.Pharm, do your MBA, please try to get into this world at least with some छोटा मोटा at least have an understanding. This world is coming your way. ये इंडस्ट्री इतनी बढ़ रही है तेजी से. $17 billion industry is projected by 2030. $1 billion कितने का है? हमारे ज़माने में 1000 करोड़ होता था. अभी 1 बिलियन नहीं, is 8,200 crores. $1 billion multiplied by 17 is 1 लाख. जाने दो, छोड़ देते उसको. 2 लाख करोड़. इतना बड़ा इंडस्ट्री है. और जैसे भी ग्लोबली कुछ भी आईटी में हो जाए, उसका सब काम तो इंडिया में होता है. बैंगलोर, पूना, इंदौर, अहमदाबाद. प्लीज रीड थ्रू दिस वर्ल्ड, इट इज वेरी इंटरेस्टिंग. टेलीमेडिसिन सुना होगा. हैव एनीबडी ऑफ यू एवर हैड अ कंसल्टेशन विद अ डॉक्टर ऑन फोन? कोविड के टाइम माई कोविड ट्रीटमेंट वॉज डन. I was sitting in home and doctor on phone. वो मैं फार्मा, वो डॉक्टर. He is telling me take augmentin. Sir, I am telling him, sir मेरे को कोविड हुआ है, कोई augmentin काम ही नहीं करने वाला है. आर्ग्यूमेंट ये वो सब ब्ला ब्ला. वो बोला फार्मा वाले को छोड़ दो, मेरे को नॉन फार्मा वाले को बिठाओ. एंड देन ही गिव मी augmentin 5 days. जाओ. That time in Mumbai, they were saying we want for everything we want a prescription. Prescription कहाँ से आएगा? WhatsApp. I am in the home, doctor in the clinic, chemist in the shop. Prescription on WhatsApp. Doctor to me, I to chemist. Now I cannot open door. Chemist is keeping a door and going. How do I make the payment? ये छोटा 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 चीज बहुत हुआ है. Already happened. Again, in telemedicine, there are two things which are happening. One, I'm sitting here, you are the doctor. चलो बात चल रही है. Second thing is happening. I am sitting, you are not there. My data is going. Everything gets recorded. डॉक्टर बाद में आएगा, देखेगा, पढ़ेगा, ट्रीटमेंट करेगा. So telemedicine में भी दो टाइप है. Synchronous and asynchronous. So interesting world है ये पूरा. ये एक और एक चीज है. Internet of medical things. So आपका बीपी, नाउ यू हैव दिस फिटबिट्स ना. कितने लोगों ने फिटबिट पहना है? किसी का है फिटबिट? है, हाँ. टेक्नोसाइवी जनरेशन है ये. सो यू हैव गॉट योर मॉनिटरिंग हियर. डॉक्टर किधर बैठा है? भंडारकर रोड. आप किधर हो? पुनावले में. आपका रीडिंग इज विथ हिम बिकॉज दे आर कनेक्टेड. ही इज ट्रैकिंग यू. ही इज टेलिंग यू आपने अभी कुछ खाया है जिससे आपका शुगर बढ़ गया. गो एंड टेक इंसुलिन. नाउ टेल मी वन थिंग, यू आर द केमिस्ट. आपका दुकान नीचे है. ओके आप बोलोगे मेरे को प्रिस्क्रिप्शन चाहिए, इंसुलिन, आई वांट प्रिस्क्रिप्शन. व्हाट्सएप गिव टू यू. सो नाउ डॉक्टर भंडारकर रोड, पेशेंट पुनौले, केमिस्ट हियर, प्रिस्क्रिप्शन व्हाट्सएप, पेमेंट जीपे, डिजिटल. इंटरनेट ऑफ मेडिकल थिंग्स इज कनेक्टिंग एवरीथिंग. आपका फोन कॉल आया, उसमें से आपका पूरा डायग्नोसिस पिकअप किया, उसको ट्रांसलेट किया, आपकी बीपी रीडिंग्स, डायबिटीज रीडिंग जो भी है सब कलेक्ट किया. इट ऑल गोज इनटू सर्स इलेक्ट्रॉनिक हेल्थ रिकॉर्ड. ये पूरा जादू का दुनिया आ रहा है. नाउ थैंक्स टू प्रैक्टो एंड ऑल दिस पीपल, अपॉइंटमेंट भी सब ऑनलाइन. ये आई डोंट नो कितना गलत सही है, बट जैसे बुक माई शो में मूवी का रिव्यू आता है वैसे डॉक्टर का भी रिव्यू. अरे कमान यार, डॉक्टर का रिव्यू कैसे करते हो यार? ठीक है. इंटरनेट ऑफ मेडिकल थिंग्स, इट इज कनेक्टिंग ऑल डिवाइसेस. लैपटॉप, मोबाइल, वॉच, phone call, everything collected, data convert into patient record. Remote care, I have experienced in COVID. I am sitting here, doctor there, mera care, doctor is taking. There is one industry called remote ICU. पता है आप लोगों को? Remote dialysis. Any idea? How are they controlling that? They are all sitting in an office and controlling patient 1000 kilometers away. So किसका कहाँ पे prescription, everything will come on WhatsApp. Remote surgery, ये तो पता ही होगा, robotics. This is now getting success. Blockchain, ये word सुना है? I'm not an IT guy, but I'll tell you one thing. Blockchain is getting used in pharma for one very simple reason. जो फेक ड्रग्स है या बिल्स बनते हैं ना, गलत बिल्स बोलते हैं ना, टू प्रिवेंट ऑल दैट, ब्लॉकचेन लॉक्स एवरीथिंग. ब्लॉकचेन, सपोज आपका रिकॉर्ड है. नॉट टेल मी वन थिंग, एक डेटा, देयर इज वन प्रॉब्लम, डेटा कैन बी हैक्ड. सपोज योर डेटा इज हैक्ड, विल इट क्रिएट प्रॉब्लम फॉर यू? सपोज अमिताभ बच्चन का डेटा हैक हो गया, हेल्थ रिकॉर्ड, हंगामा हो जाएगा क्या? शाहरुख खान का डेटा हैक हो गया, हंगामा होगा. आपका मेरा होगा तो छोटा मोटा नुकसान, उनका हो गया तो, मोदी का हो गया तो भगवान मालिक. ठीक है. सो इफ डेटा ऑल्सो नीड्स टू बी प्रोटेक्टेड. सो जो ये प्राइज वगैरह होते हैं, नाउ आई गिव एन एग्जांपल. पेशेंट को महंगी दवाई पहुंचाना, इंडिया इज अ मास्टर ऑन जुगाड़. हमारे यहाँ जुगाड़, पेशेंट का जन्म भी नहीं हुआ है, उसका पूरा हॉस्पिटल रिकॉर्ड बना के रख देते हैं हम लोग. सर वाज टेलिंग इन द मॉर्निंग, दो मेनी फॉल्स इंश्योरेंस क्लेम्स. ब्लॉकचेन इज बीइंग यूज्ड टू प्रोटेक्ट अगेंस्ट ऑल. keep the role being played. Okay, word O. Why should I highlight as digital device? का मतलब एक जमाना था, या आज भी है रदर, ऐसा कोई ये नहीं हुआ है कि हार्डवेयर के अंदर सॉफ्टवेयर डालो. अभी सॉफ्टवेयर ही डॉक्टर बन रहा है. ये भी जनरेशन आ रहा है. गाइस, ये सब कुछ ना इज कमिंग योर वे. देयर आर सो मेनी थिंग्स. टाइम बहुत कम पड़ जाएगा. 40 minutes इज टू लेस टू कीप अबाउट दिस. ओके, आई गिव एन एग्जांपल. How many of you snore? How many of you snore? कोई बोलेगा नहीं, मेरे को पता है. घर में कोई स्नोर करता है क्या? करता है? Is snoring good or bad? It is very bad for health. Okay. If it develops, it is something called as sleep apnea. तो now उसका स्लीप को अच्छा करना है, उसके लिए भी डिवाइस आ गया है. देयर इज अ कंपनी कॉल्ड रेस्टमेड, एंड उसके पहले फिलिप्स भी था, बट फिलिप्स हैड सम इश्यू. रेस्टमेड, हाउ इज द पर्सन स्लीपिंग इज कैप्चर्ड ऑन द सॉफ्टवेयर एंड द फीडबैक इज गिवन. कहाँ तक हम जा रहे हैं यार. ये तो पहनते होंगे यार घड़ी. हाँ, घड़ी पहनते हैं ना. कौन सा घड़ी है? हाँ, फायर. आपके घड़ी में है, आपके कपड़ों में है. ओके, इट इज टॉकिंग अबाउट मेनी ऑफ यू हर्ड दिस वर्ड कॉल्ड मेटा. किसका है? अभी जामनगर में आया तो फेसबुक फ्लॉप हो गया उस टाइम पे, राइट? मेटा, नाउ इट इज एक्सपेक्टेड कि डॉक्टर पेशेंट कनेक्ट विल बी ऑन मेटा. ये हम लोगों ने सोचा भी नहीं है कभी. प्रिस्क्रिप्शन मेटा पे आएगा क्या? पैसा भी मेटा पे आएगा फिर. दिस इज द वर्ल्ड विच इज गोइंग टू कम नाउ, एस्पेशली इन द वर्ल्ड ऑफ एजुकेशन, पेशेंट एजुकेशन, मेडिकल ट्रेनिंग. इसमें आने वाला है वर्चुअल रियलिटी, ऑगमेंटेड रियलिटी. ये क्या समझने से पहले आ गया एक्सटेंडेड रियलिटी. एक्सटेंडेड रियलिटी इज नथिंग बट ऑगमेंटेड रियलिटी प्लस वर्चुअल रियलिटी. ये समझ में नहीं आया तो मेटा आ गया. This is the way things are changing. So guys, आप लोग जब तक मैदान में उतरोगे ना, try to get yourself at least aware about what is happening in the world. I'll not go in the precision medicine. Okay, this will be your world. कौन कौन से molecules आपको पता है? Antibiotic या anything. कौन कौन सा पता है? One molecule name you take. Azithromycin. अभी आप बोलते हो क्या ये एजिथ्रोमाइसिन पूनावाले के ये बिल्डिंग के लिए है, ये एजिथ्रोमाइसिन बानेर के लिए है, ये एजिथ्रोमाइसिन हिंजेवाड़ी के लिए है. बोलते हो क्या? ये एजिथ्रोमाइसिन पूनावाले के ए विंग के लिए है. ये वर्ड आ रहा है प्रिसिशन मेडिसिन. व्हाट इज प्रिसिशन मेडिसिन? एजिथ्रोमाइसिन बनेगा, आपकी फैमिली हिस्ट्री क्या है देखी जाएगी, जेनेटिक्स देखा जाएगा, आपके पूरी रिकॉर्डिंग ली जाएगा, मर्ज किया जाएगा. एजिथ्रोमाइसिन प्लस ये दवाई इक्वल टू योर दवाई. दिस इज द वर्ल्ड कॉल्ड प्रिसिशन मेडिसिन. ये आ रहा है. डिजिटल ट्विंस, ये पूरा ना स्टार वॉर्स मूवी बन रहा है मेरा. इट इज वेरी एक्सपेंसिव टू डू अ रिसर्च एंड डेवलपमेंट. तो करते क्या ये लोग? आपका एक डिजिटल ट्विन बनाते हैं एंड दे क्रिएट अ स्टडी ऑन दैट डिजिटल ट्विन. रैट मॉडल होता है ना, ब्रेन मॉडल एंड ऑल दैट स्टफ, डिजिटल. ये पूरा उसका बेनिफिट रहेगा. R&D में बिग रोल. दोज ऑफ यू हु आर ट्राइंग टू गो इनटू QA, QC, R&D, दिस इज गोइंग टू कम डिजिटल ट्विन. ये इतना खत्म ही नहीं हुआ. अभी गूगल पे एक नया क्वेश्चन आ रहा है, विल ChatGPT रिप्लेस डॉक्टर्स? Bhagwan Malik, I don't know. But then next question, what about pharmacist? ChatGPT can't become pharmacist. But on the serious side, I'll tell you one thing. I have got 2 friends working outside in US and Europe in pharmacy. There the job is very strict of a pharmacist. Doctor ऐसा वैसा कोई भी prescription दे नहीं सकता है without the pharmacist approval. In our country, we are bit flexible. Not bit flexible, we are flexible. But please understand one thing. If you are actually doing your job properly, it can pay you rich dividends in this pharmacy career. From a career window, ये पूरा Star Wars movie था, okay? But ये आ रहा है 2028 से 2030 के बीच में जिनका career का progression का journey है, please start get prepared. And the last part, हमारे देश में क्या हो रहा है? एक चीज है यार, you can clap for yourselves. India today ranks, sir, thanks to you, India today ranks as the most growing healthcare industry. It is growing like this. ये हम लोग अभी ग्राफ यहाँ नहीं दिख रहा, बट शायद हम लोग यहाँ पे गए थे. $367 billion इंडस्ट्री है ये. 1 बिलियन यानी 8,200 आज का डॉलर का भाव, मल्टीप्लाइड बाय 367, वो जितना आता है उतना ये, this is the country. Okay. Now look at one funny part. I am a person who's from marketing, so मेरे को trends पढ़ने का बहुत शौक है. Like sir said, there is diagnostics, there is pharmaceutical companies, there is hospitals, outpatient departments. एक चीज जो बढ़ रहा है, in 2019, health tech startups contributed only 1%. It is projected by 2030 they will contribute 7%. Now 1% of whatever was here to 7% of whatever is going to be there means it is going to be big. India has got a very booming health tech setup. Any idea Pune में health tech है क्या? कोई idea है Pune में है क्या? 358 startups are there in Pune. In Pune. I am a volunteer in that group. मेरे को जस्ट देखने का था ये लोग करते क्या हैं. तो इनका अपना ही मारा मारी रहता है, पैसा नेचुरल है. स्टार्टअप के लिए पैसा इज अ बिग ब्लड प्रेशर. पैसा, फिर कस्टमर, गवर्नमेंट का अप्रूवल, एवरीथिंग. बट टुडे इंडिया हैज गॉट समवेयर अराउंड हाउ मेनी 5,295 हेल्थ टेक स्टार्टअप्स आर देयर इन इंडिया. आज है. इसमें लीड कौन करता है? बैंगलोर. Then you have India, Pune. Then you have cities like Bhubaneswar, Indore, Ahmedabad, Gurgaon, some degree in Kolkata, Hyderabad. How can I forget Hyderabad? Hyderabad. Now, एक गोष्ट जे मराठी माणसाचं मला अजिबात आवडत नाही. How many of you are Maharashtrians over here? अरे सब लोग ही है. Even I am there. हमारा एक प्रॉब्लम है यार, हम हमारा देश छोड़ के नहीं जाएंगे. ये केस में देश पुणे है, भारत भी नहीं है, पुणे. बट देन वेयर आर योर जॉब्स? प्लीज आस्क योरसेल्फ, वेयर आर योर जॉब्स? यू वांट टू वर्क एज अ फार्मासिस्ट, you want to work as a product manager, you want to go into sales, you want to go into R&D. As of now, pharma companies are only in 4 cities: Mumbai, Ahmedabad, Bangalore, Hyderabad. Pune 2 कंपनियां हैं जो रेप्यूट की है. बट इफ यू हैव टू मूव आउट, इफ यू वांट करियर, यू हैव टू बी मूविंग आउट. मुंबई इज द हब फॉर फार्मर. स्लोली इट इज कमिंग टू नवी मुंबई, बट बीच में लोनावाड़ा है तो उतना तो जर्नी आपको करना पड़ेगा. अभी आपका लोकल लोनावाड़ा तक जाता है, उसके आगे नहीं जा रहा है अभी, तो थोड़ा बाहर निकलना पड़ेगा. इफ यू आर टॉकिंग अबाउट हेल्थ टेक स्टार्टअप्स, पुणे, बैंगलोर, भुवनेश्वर, हैदराबाद, Ahmedabad, Indore. Pharma companies are now investing in startups. So they are also expecting. For your information, 2 companies have already launched divisions of health tech. What do I say? Digital health. One is Lupin. They have launched a division called Lupin Life. Right now, they are having a digital therapeutics for cardiology, and Dr. Reddy's they have launched in neurology. for migraine. Now question, कंपनी आ रही है, ये हो रहा है, वो हो रहा है, हम लोग adopt कर रहे हैं क्या? Practo, are people using Practo? People are using Practo. Pharmacy, 1mg, pharmacy, all that, it is getting adopted. Fitterfly, they are helping in wellness, Beto and all those companies. Then Abbott has launched one continuous glucose monitoring device called LIBR. यहाँ लगाया 14 दिन मॉनिटर किया, अगेन पेशेंट पुनवले, डॉक्टर भंडारकर रोड, प्रिस्क्रिप्शन पुनवले, पेमेंट जीपे, डिजिटल, एंटायर रिकॉर्ड इज डिजिटल. आपने सुबह ब्रेकफास्ट में 2 इडली खाया, शुगर बढ़ गया, रिकॉर्ड. लंच में आज 2 रोटी के बदले आज ना रसमलाई अच्छा था तो 2 रसमलाई खाया, ग्लूकोज शूट, रिकॉर्ड, डिजिटल. एवरीथिंग इज गेटिंग डिजिटल. Fitbit, everybody is now this company which is handling Fitbit, इनका सेल देखो क्या है, they have sold 120 million Fitbits till now. 1 बिलियन यानी 10 लाख, इतनी घड़ियां बेच चुके हैं लोग. This is one of the biggest success stories of digital in India. ये आरोग्य सेतु ऐप एंड इसके चलते जो सर्टिफिकेट्स लोगों को टाइम पे गए, probably this is one of the biggest successes. तो गवर्नमेंट also is adapting. Now, since you are all from pharmacy, ये चीज आप जानते हो क्या? Are you all aware of this factor? Sometimes you call it Ayushman Bharat, sometimes you call it National Digital Health Mission. The purpose is, जैसे आधार कार्ड है, वैसे they are going to issue a card called ABHA. This, all the record, एक सिर्फ कार्ड का आपने नंबर दिया, your record is accessible to any hospital everywhere. This is another achievement which is happening, e-Sanjeevani OPD. If you have not heard or read, please go and check out this. This is Government of India initiative. This is nothing but e-OPD. पता नहीं डॉक्टर्स कहाँ पे हैं, but already India has seen 100 million e-OPD visits. So guys, this is from my end. But 5 tips for you people who are now aiming for taking a journey to a career. मेरा पहला हम लोग जितना साल जिए मरे वड़े दौर, प्लीज डोंट लीव दिस, बी अ गुड रीडर. रीड, गूगल पढ़ो या whatever पढ़ो. आई एम नॉट सेइंग इंस्टा एंड ट्विटर एंड टिंडर, आई एम सेइंग अबाउट बुक्स. वॉच ट्रेंड्स विच आर हैपनिंग. नाउ सर ओनली वाज सेइंग कि मणिपाल हॉस्पिटल ओवर हियर एंड खराडी. व्हेन आई लेफ्ट पूना इन 2006, मेरे को याद नहीं तब आदित्य बिरला एक नया सा आया था. आई थॉट चलो यार पूना में एक हॉस्पिटल नया आ गया. तब तक रूबी, जहांगीर, दीनानाथ, पूना हॉस्पिटल, ओके. नाउ आई कम टू पूना आफ्टर 17 years, हॉस्पिटल. सो टाइम्स आर चेंजिंग, तो प्लीज वॉच ट्रेंड्स. और एक चीज, इफ यू वांट टू गो इनटू कॉर्पोरेट वर्ल्ड, नो, प्लीज डू वन थिंग, डेवलप योर वोकैबुलरी. अगर फार्मेसी है तो फार्मेसी की वोकैबुलरी डेवलप करो. डेवलप योर वोकैबुलरी. दोज वर्ड्स दे हेल्प यू व्हेन यू टॉक, दे हेल्प यू. डू नेटवर्किंग. हाउ मेनी ऑफ यू आर ऑन लिंक्डइन? Okay, now one wrong question, how many of you 1 or 2 years down the line will be looking out for jobs? सबको जॉब करना है कि नहीं करना है? आज नहीं, 2 साल के बाद या जब भी करना है, MBA के बाद करना है ना. प्लीज मेक योरसेल्फ एक्टिव ऑन लिंक्डइन, because that is where you will get people, the right people who will help you with job. इनके साथ जुड़ना करो शुरू. आपको सपोज यू वांट टू जॉइन सन फार्मा, लिंक्डइन पे जितने लोग हैं निकालो, उनके बारे में पढ़ो. हु दैट HR गई, उसका पूरा कहानी, लाइक मैडम रेड आउट अबाउट एवरीथिंग अबाउट मी फ्रॉम लिंक्डइन ओनली, अबाउट सर फ्रॉम लिंक्डइन ओनली. ये हम लोग इतना लिखते नहीं है. प्लीज डू दैट, इट विल हेल्प यू. प्लीज डू एक्टिव नेटवर्किंग. खुद का ब्रांड डेवलप करो. एलॉन मस्क, एनी आइडिया क्या है क्या वो आदमी? व्हाट इज ही? नॉर्मल. टेस्ला, ही ब्रॉट ट्विटर, उसका सत्यानाश कर दिया, भगवान मालिक. बट हाउ मच डिड ही पे? $42 billion. छोटा अमाउंट नहीं है. मनी, ही इज अ ब्रांड. डेवलप योरसेल्फ एज अ ब्रांड. एंड if you are going into this industry, especially in marketing, I am not saying about other sectors, I don't know, I am from marketing, I can say, at least 2 years spent in sales. In sales, you will get to know the customer. वो जिस प्रकार से बात करता है ना, it will help you. And last, have a milestone approach. आज से 2 साल में कितना बनना है, आज से 5 साल में कितना बनना है, आज के हम लोग सब यहाँ अमीर घर से कौन है, कोई बताएगा नहीं. इनकम टैक्स, आई एम नॉट फ्रॉम इनकम टैक्स, डोंट वरी. वी आर ऑल फ्रॉम नॉर्मल मिडिल क्लास. वी आर वर्किंग फॉर मनी, वी आर वर्किंग फॉर आवर फैमिलीज. हैव अ माइलस्टोन. हाउ मच शुड बी माई सैलरी 2 years फ्रॉम नाउ, 5 years फ्रॉम नाउ, 10 years फ्रॉम नाउ. अभी का CTC का पूरा डायनामिक्स ही अलग है. हमारे टाइम पे CTC 1 लाख है, वो अरे बाप रे. अभी CTC 20 लाख है, ओके, ठीक है. दैट इज चेंजिंग. प्लीज हैव अ माइलस्टोन अप्रोच. सो थैंक यू. Yeah, please. No. Just have a sip of water.
Jai Shri Ram sir. Good afternoon. I am Siddharth Tuple from Dr. D.Y. Patil College of Pharmacy. I am doing M.Pharm in Quality Assurance. I have one question for you. Is there good career in molecular docking in India?
Is there
good career in molecular docking?
Molecular
docking.
Documentation.
No, molecular docking. Drug development.
Drug development.
Yeah, it's related to drug development. It is a molecular docking, the concept.
So now good question. We look at our drugs. Where are they coming from? US, Europe, Japan. Most of those drugs are from there. Now when we come to this world of digital, in India job limited hai. The sector which you are specific. Though I am not a master in that. My area is in marketing. But globally there is a huge demand. Okay. I will give an excellent example currently which is happening of a drug called semaglutide. Okay. इसका documentation या पूरा जो भी journey है, it took 10 years US में for that whole journey to happen. So if you are asking me, am I the right person to give an answer to you? No. I am from the marketing side. Okay. But ये sector जो आप बोल रहे हो ना, US is a very hot country for that. Japan and parts of Scandinavian countries, Denmark and all those belts, Sweden and all, they are very strong in that. Germany.
Thank you, sir.
Yeah.
सर तुम्ही जे बोलले आता की डिजिटलचा ट्रेंड आहे सर, ते गव्हर्नमेंटमध्ये यायला त्याला किती वेळ लागेल, म्हणजे गव्हर्नमेंट सिस्टीममध्ये?
आवाज येत नाही आहे
सर. जे डिजिटलचं बोलले तुम्ही आता, ते गव्हर्नमेंटमध्ये यायला त्याला किती वेळ लागेल, गव्हर्नमेंट हॉस्पिटल्स वगैरे जॉबसाठी?
काय डिजिटलायझेशन
सोडून? हां.
सी डिजिटलायझेशन. ओके, आय विल गिव्ह एन एंटायर. गव्हर्नमेंटलाच बाजूला ठेवा, मी फार्माबद्दलच बोलतो पहिलं. फार्मा इज द स्लोवेस्ट इंडस्ट्री फॉर डिजिटलायझेशन. स्लोवेस्ट, सगळ्यात फास्टेस्ट FMCG आहे, स्लोवेस्ट फार्मा आहे. कारण फार्मामध्ये एक प्रॉब्लेम जो आहे तो वरून प्रश्न आला, रेग्युलेशन्स. ओके. आपल्याकडं डिजिटलायझेशनची सगळ्यात मोठी आता जी चर्चा चालू आहे ती ह्या आभा कार्डची चालू आहे. पण आय विल टेल इट विथ वन अश्युरन्स, 2027 to 2030, by the time you people are actually going into jobs and all that, no, digitalization will be part of your daily life, especially from pharma side. कारण सगळं डिजिटलच विश्व येणार आहे तेव्हा. आता एक एक्झाम्पल म्हणून देतो. Government of India has launched this card, ABA. Okay, they have to reach to 140 crore. Okay, once this all 140 crore cards are given, what will they do with that card? त्या कार्डचं पर्पज काय असेल? त्या कार्डचं पर्पज एक सिंपल आहे, पूर्ण हेल्थ रेकॉर्ड, जस्ट लाईक अवर आधार, आभा. आता हेल्थ रेकॉर्ड कसं होणार आहे? डिजिटल होणार आहे. कुठं कुठं ॲक्सेस होणार आहे? सगळीकडे ॲक्सेस होणार आहे. गव्हर्नमेंट, प्रायव्हेट, सिंगल नर्सिंग होम, एव्हरीबडी विल गेट ओनली वन कार्ड. सो डिजिटलायझेशन विल बी पार्ट ऑफ एव्हरीबडीज लाईफ विथ दॅट आभा कार्ड. आता ई फार्मसी, टेलिमेडिसिन, ऑल दिस इज कमिंग एट गव्हर्नमेंट लेवल ओनली. गव्हर्नमेंटकडनं सुरू झालं, पण आपल्याकडे म्हणतो ना ते धक्का दे धक्का, इट टेक्स टाइम. पण 2027 to 2030 इंडिया इज, इट इज देयर बीइंग सेइंग इन फार्मा, तो बोल रहे कि एवरीथिंग विल गो डिजिटल. अभी सर ने तो बताया कि जो मेडिकल रिप्रेजेंटेटिव का कॉल है वो भी ऑनलाइन हो जाएगा. Can I take this out so I can speak with my?
Hello. Hello.
Yeah,
Am
please.
I audible, sir?
Yeah, yeah, please.
My name is Priyanka Soni. I'm from Modern College, Pune. I wanted to ask you, nowadays there are so many crash courses and diploma courses they are giving for AI tools like ChatGPT and all. Are you asking to have a mastery in ChatGPT generally or in healthcare? For like narrowed it down to healthcare in AI tools.
Marketing का एक principle narrow down. Narrow down.
So you are saying that only the AI tools which are required for healthcare you should.
Ma'am, what is your background?
I am doing MPharm in pharmaceutics.
Great. So ma'am, what is your career you are looking at?
I want to join in the CDM team, and right now I am also having a training in the SaaS, clinical SaaS software, so that I can have the approach for the foreign. Also, I can go there also.
Natural progression वही रहता है.
Yeah.
ठीक है. You choose one track. See, I'll tell you one problem. ये deck का एक बड़ा problem मेरे को बाद में महसूस हो गया. There is so many things. You choose one track. AI. Are you an software engineer? You are not. You want to learn AI from healthcare point of view. Only take that much first and focus. Understand what is happening there, and then एक के ऊपर एक ऐड करते जाना. एंड आई विल गिव इट टू यू इन राइटिंग. आप जो भी अभी पढ़ रहे हो 2 साल के बाद पता चलेगा आप और कुछ पढ़ो. बट स्टार्ट विथ समथिंग वेरी बेसिक विच इज रेलेवेंट टू हेल्थ केयर. चैट जीपीटी बिग, टू बिग, वेरी बिग. सपोज जनरेटिव एआई फॉर एग्जाम्पल, कि हेल्थ केयर में इसका रोल क्या रहेगा. इज एनीबडी ऑफरिंग? Check that. Now I'll give an example. IIM Raipur is the only institution in the country which has started a course on digital health. They offer 3 types of courses. One is 3 month, one is 6 month, one is 1 year. 3 month is basic, 1 year is full time. It's like that. You can choose, but they are the only one right now who are certified.
Sir, 1 minute, sir.
Good afternoon, sir.
Yeah, please.
Sir, I'm Kaveri Ganjure. I'm currently doing MPharm in pharmacology. I just wanted to ask, everyone is saying you are students, develop some skills, have a good vocabulary and all. Can you mark some other skills which we can develop during our education so that we can be fit for the industry and commercial world?
Fantastic question. ये सब बाद में, ये पहला. First know, आपको करना क्या है MPharm करके? What sector do you want? R&D, marketing, क्या करना है आपको?
Sir, I was thinking about joining clinical trials and clinical data management.
So there you require a lot of good writing skill.
Yes, medical
अभी मेरे को AI का रोल कितना है वहाँ पे पता नहीं है, but I can tell you one thing: you require good command over your language.
Yes, sir.
So first requirement is that.
Yes.
Okay. Second, which is a requirement in any corporate role, is interpersonal communication.
Yes.
See, India runs on one thing, जुगाड़. आपको दूसरे से काम करवाना होता है. So you need to talk. How to write an email. I don't know how many people write an email properly. You do these 2-3 things properly, no? You have done a big thing. So get command on your language, especially for you who is going to go into such a role. If you are talking about vocabulary, what does vocabulary mean? I'll tell you, this was, somebody said it, I don't know who said it. If you know 1,000 words of your domain, you are a master. You are a master. आपको कोई हाथ नहीं लगा सकता है. 1,000 words. So आप clinical documentation, suppose you want to go, know that domain, what is the language that is being used, how it is written, and अगर देखना है documentation, तो please check out how documentation is done in MNC companies. I think in Pune there is Roche, if I'm not wrong. They are very stringent. अच्छा documentation करते हैं लोग. See there. And देखो, और एक चीज करो, get active on LinkedIn, connect to people who are doing this. Best thing to do. And they will help you. They help. करते हैं. They do. Communication, have a command on your language, and interpersonal skills. This is 3 things I'll tell. ये 3 तो करो ही.
Yes, sir. Thank you.
Good afternoon, sir. I am Mike Patel. My question is, what sort of special courses we must pursue in order to make a career in clinical research and trial development? And is there an opportunity to grow in that career, and where?
Okay, I am actually not right fit for this topic. I am a marketing guy.
Yes, sir.
I typically follow Narendra Modi, Danda. Okay. मेरा 30 साल उधर ही गया है, business. But clinical research, if you see where does it happen, पुणे में अच्छा खासा होता है. So एक अच्छा सुकून है. It is in my city, Pune, Bangalore. You want to follow there are some companies in Navi Mumbai. Okay. See, documentation का role है, clinical research का role है, and people are looking out. If you want to understand what are the needs of this thing, no, again I'll suggest LinkedIn. Connect with medical teams of pharma companies, not your डॉक्टर जो बाहर बैठते हैं. नहीं, फार्मा कंपनी में बैठने वाले डॉक्टर जो होते हैं ना, फॉर एग्जांपल जस्ट गो एंड टाइप टुडे, लेट्स से व्हिच इज द फर्स्ट कंपनी, एबट. ओके, एबट का टाइप करो, यू विल गेट पीपल. इन पीपल चेक डॉक्टर्स, जस्ट राइट देम, आई एम अ स्टूडेंट, आई वांट टू डू दिस, एंड कनेक्ट विद डॉक्टर्स. दे हैव रिक्वायरमेंट ऑफ क्लिनिकल रिसर्च. इंडिजिन इज वन कंपनी फ्रॉम बैंगलोर, वेरी स्ट्रांग. देयर आर कंपनीज इन नवी मुंबई, दे आर डू अ लॉट ऑफ दिस वर्क. पुणे में काफ़ी है, 30 तो पता है, बट मुंबई ही फाइनल डेस्टिनेशन वही रहेगा.
Okay, thank you, sir.
Be ready for the pasina of Mumbai. One suggestion from my side, if you are planning to enter the corporate world, just don't try to make an entry on the merits of your B Farm. You will end up in a very, what is it, the baseline. Do your B Farm, do a specialization in MBA, the sector which you want to go, उसी को choose करो. Be very clear, करना क्या है. I like this line of today's generation, पता है क्या करना है. हमारे टाइम पे पता नहीं था, जो इंटरव्यू ऑफर आए गए. Okay, do that MBA specialization side by side. Like one thing which I heard today, which I liked, there are 10 certifications by the time you complete your first year. Do that. Skill sets develop karo, and then you are open. But my suggestion is do networking. Spend time. I'm not talking Insta, Tinder, nahi. I'm talking LinkedIn.
So there are few people who are attending this session through online mode, and they are sharing their views that the session was really informative and interesting. As well, they have some questions. So may I, sir?
Please.
How ethical and moral practices can be enhanced in pharma sectors, and how to discourage cut practices and many more such things?
By the time I die, I prayed that something happens. Okay, there is Government of India's initiative called UCPMP guidelines. Okay, आया था some 5-6 months ago. I don't know if there is any doctor over here, pardon me, but doctors only opposed. Doctors and pharma companies only opposed. So it's a grey area, a hot debate. But government is working on guidelines which were actually drafted. They are called UCPMP guidelines on practices, marketing practices. See, I am from marketing, so मुझे पता है वो कितना dirty side है. So these guidelines are there, they are all documented, but diplomacy says, चलो करते हैं. Hey, it is like that.
Okay, sir, one more. How can we use AI to predict diseases?
Wow. Could we predict COVID? So COVID happened in 2019. If you go back 1 century, 1919, there was something called a Spanish flu. ये century में एक बार ही आया. This is called Spanish. These are called black swan events. कभी तो आते हैं and बर्बाद कर देते हैं. Okay, but lot of people in IIM, IITs in many places, Bits Pilani, and they were doing this thing. What will be the prevalence? They used AI for that. For how long it will stay? तभी आता था ना 120 दिन रहेगा. Then 160 दिन में चला जाएगा. All that stuff was coming. This is all coming thanks to AI. अभी obesity आया है. 100 crore. I will give it to you in writing. Novo Nordisk has used AI to predict ये कितना बढ़ेगा. Obesity तो आ गया. Now take it from me in granted. Novo Nordisk will now print money for life. So they will use AI. But a good question, AI is getting used for drug discovery. AI is cutting down the drug discovery time from 10 years to 2 years, 3 years. They are using a word called digital twins now. Predicting disease, वो astrologer को साथ में लेके बैठना पड़ेगा. Difficult one.
Sir, one more. Sir, tell us about the importance of GPAT and NIPER examination.
Should I answer it? No comments.
Thank you so much, sir.
In Australia, New Zealand, I had read, now they are making it compulsory to bring pen and paper for exam. No mobile, no laptop. They are stopping ChatGPT entry into room में. Exam के लिए paper pen वापस आ रहा है. If I am correctly answering. Thank you.
Thank you, sir.
Thank you, sir, for sharing your valuable thoughts with us and knowledge about digital health and medical technology. So, now I welcome our distinguished guest, Dr. Shoma Srivastav ma'am, with 26 years of rich and diverse experience, academia, corporate training and pharma marketing within esteemed multinationals. A TISS certified master trainer, she has played a pivotal role in shaping training, operations and delivery across various sectors and organizational levels. Ma'am, notable achievements include spearheading national and international programs on leadership development at the State Bank of India, with a special focus on mentoring women leaders to foster diversity within the organizations. As a professor and director of the Center for Lifelong Learning, ma'am has pioneered a residential coaching program for IAS, showcasing a commitment to excellence in education. Her collaboration with premier institutions such as IIM has been instrumental in bridging the gap between academic knowledge and industry readiness, particularly emphasizing communication skill among graduate and postgraduate management students. With a strong track record of creating solutions, our guest has been integral in addressing disparities in IT education to meet industry standards. She has led training and placements at MBA, hospital and healthcare program at SIU, mentored the launch of an MBA in Pharma as a new specialization at Pune University, and served as a member of the Board of Studies at Schools for Vocational and Distant Education. Beyond academia, our guest has made significant contribution to the corporate world, pioneering the concept of regional brand management in pharmaceuticals with Ranbaxy and establishing operations in Bolivia, South America, as a commission agent with Petrus Pharmaceuticals, an active member of professional bodies like an Indian Women Network, Confederation of Indian Industry, and a higher education forum. Our guest is actively involved in spearheading projects related to skilling and employability. Join us in welcoming a seasoned professional, a thought leader, and trailblazer in the field of education, training, and industry collaboration. I request Dr. Rajesh Gade sir to come forward and felicitate Dr. Shoma Srivastava ma'am. Now I request Shoma Srivastava ma'am to address gathering.
Thank you so much. What's your name?
Durga.
Durga. Okay, thank you Durga so much. And my God, that feels really too much to follow up with, right? So I'll keep it simple. I was not stipulated to talk, but I was requested for some words of encouragement, especially for the women or the female population of pharmacists that we have here, and I can see the smiles coming in. And tomorrow being Women's Day, I thought probably it would be a good idea to give some, of course, not to be biased towards them. I have students from varied backgrounds, various diverse backgrounds, and it's always been a pleasure to interact with them. So I was just thinking that the podium was down. I said, same level pe baat karenge, you know. So abhi, of course, the podium has come up. But feel free to ask me any questions. I know I'm standing between your lunch to start. So if you're hungry, feel free to tell me that too. Yeah? Yes. So I have just made a couple of notes as we were talking. I'm also a fellow dinosaur. I've also passed out in 91 from BITS Pilani with a B.Pharm degree. This was 87-91. So ancient in many ways. I joke I have 26 years of experience and 54 years of existence. So that's brief about me. And so feel free to ask me what I thought would probably add to all that has been spoken. A lot of hard talk has happened, right? So I was thinking I'll focus on what we call the soft skills. सुना है? हाँ? मेरे को मराठी में आप क्वेश्चन पूछ सकते हैं, मैं आपको हिंदी में आंसर दूंगी. मराठी आता है मुझे, but I will speak in Hindi wherever required. You can ask me in Marathi, absolutely no problem. In fact, Bengali is also a language I know, so if you want to ask me in that language is also fine. Okay? So we will speak about soft skills. Abhi, have you heard of this word called soft skills? Hard skills, soft skills, है ना? Yes? So what do you understand by soft skills? Let's now ask the questions the other way. Yeah? So tell me, what do you understand by soft skills? There's no right or wrong answer. Aap bilkul mat dariye. The idea is to be able to speak up. That's another skill that you will require. As you're speaking about career paths in pharmaceutical industry, if you don't speak up, you will not be heard. Yeah, so my duty as an educator is very importantly to help you to think. That I think is my prime duty. So what is soft skills? सुना है पर कभी सोचा नहीं कि soft skills है क्या? किस चिड़िया का नाम है? Okay, let me make it simpler for you. Yes? Yes, someone was trying to say something? Go ahead. Okay, the way I would put it, or the way most people put it, is hard skills will give you the interview. है ना? Hard skills will help you get the interview. Soft skills will help you pass that interview, because आपका resume देख के बोलेंगे अच्छा इसको बुला लो interview के लिए, है ना? Right? फिर you will get that interview, but it will help you get the job and it will help you keep it. तो अगर आपको job चाहिए and आपको अपना job रखना है, you will have to get better with soft skills. And I don't know if Tushar is there here. Placements, I'm sure a lot on readiness in industry is important. Corporate readiness, employability, ये सब सुना होगा ना आपने? That would really be important. So I was just making a few notes of things I could add to the discussion, because a lot of wonderful talk has happened, and I thought, some few things. So for instance, I will tell you about a day before that, I was in Gurgaon training the IP team of Fresenius Kabi. Right? So tomorrow's world will require a lot of team building, teamwork. Yeah, the reason they engaged me as a trainer for a day of workshop was because they realized that the entire team is not working as a team. And that can be disastrous. A marketing person is there here, the hospitals are there. If we don't work as a team, we are not able to achieve anything. Right? So that becomes an extremely important thing for which people are ready to pay for an entire workshop whereby they are taking trust and other issues which is related to team building, right? But before I get into that, what do you think is the most important skill that you have? And it has been a clue to you. It has been touched upon in the earlier session, or probably before that also. What do you think is the most important soft skill that you will require? Absolutely, communication, right? So, अगर आप अपनी बात ही नहीं कर पाए, अगर you're not able to communicate your skills, how will you be able to succeed, right? So communication becomes your very important weapon that you must develop as a soft skill, right? And I will just reverse the role. When Sir was saying, he was saying, no, I am forgetting that. The second part was language skills. So communication, language skills, and the third part was something else. I would reverse the order. I would say, first, get that mastery over language. And whether we like it or not, Hindi, Marathi, whatever local language will work, we still need some working knowledge of English. Would you agree with me? Yes? So you have to fortify that basic, क्योंकि वो foundation है आपका. अगर language का foundation नहीं है, तो आप communicate कैसे करेंगे? Right? So in fact, I'm developing a special English language program for pharmacy graduates and postgraduates for helping them get that minimum level of competency or proficiency in English to be able to do well, right? And that becomes your language, becomes your foundation. So, thoda sa kaam kariye aap to make that language strong. Whether how you want to do it, I leave it to you, but it is a requirement. Okay? So, language proficiency based on which your communication skill will be extremely important. Okay? So, that's one thing you must never forget. Other than that, learnability. Now you will see that we spoke about a lot of things. Agar you don't, the fact that you're sitting here and I think upstairs people seated there, are you here because you want to learn, right? So at least aapne starting steps to le hi liya hai. But keep this burning desire to learn, because learnability is another skill which people will look at. There are companies which tell me कि भैया मेरे को आप technical knowledge इतना पे भी रहेगा तो दे दो. But the person has to have the thirst for knowledge, should be wanting to learn, Okay, so that learnability is going to be an extremely important part of yours. I'm sorry, I'm just speaking extempore, so it might not be structurally there. I always like a PowerPoint whenever I'm presenting. So this is the first time I'm trying to do it, so please bear with me. And learnability will be very, very important. And from diarrhea to diabetes to depression to wherever we go, technical skills will be required. But you need to fortify your soft skills. What are the soft skills are required? Let me give you another clue. In the summit byline as well as conference, one more skill, soft skill is very prominent. What is that? Presentation skills. मैं communication के साथ अभी club कर रही हूँ because of keeping it short. I'm trying to keep it as brief as possible. Presentation skills very important, yes. But look at the matter. Presentation is one part of it. Content देख के आप मेरे को बताइए और क्या एक skill है which is prominent? Innovation. Innovation से क्या आता है? Creativity skills, right? So the more creativity skills that you develop, you will prosper that much further in life. People are looking for innovators. People are looking for creative people. So the more you develop that skill, the more chances of you landing a great job and getting promoted as you move along. So that's another skill that comes up, okay? Teamwork, I've already spoken to you about. Empathy in the medical and the healthcare, and I'm sure the sir will also agree with me, that in the hospitals, Manipal Hospital also, he must be definitely looking at empathy as a very important skill, right? Because we're dealing here with troubled people, where we need to keep a complete empathy for their requirements, right? And everyone understand empathy here, है ना? अपने आप को दूसरे के shoes में डालना, right? So that's what, and I would say even walk in those shoes. पहले तो वो जूते पहनो और फिर चल के भी देखो कि कैसा लगता है ना? Aging population, हम अब aging population के बारे में तो सोचो कैसे, what are the paradigms, what are the dilemmas that these people are facing? तो अपने आप को उनके shoes में डालिए, right? And after this I probably will break for questions, but एक very important thing that also came up here is that learnability से related है, Google बाबा तो है ना? तो उन्होंने आपको Dr. Google बाबा, whatever, he's giving you answers, right? So what is now becoming a very important skill that you must have? So in learning, what will you do? Sorry? Technology is one. Okay, to keep up with the technology, what do you need to do? Answer is wrong or right. Go one more step behind. I'll get it through you only. To know the answer and right or not, पहले क्या करना है आपको? Explore. Explore में क्या करते हैं आप? Explore में search करते हैं ना? Search क्या type करते हैं वहाँ पे आप? Question type करते हैं? फिर ही वो answer देता है आपको ना? तो अगर उसको आंसर देना है आपको तो आपको राइट क्वेश्चंस ढूंढने पड़ेंगे ना. पहले क्या था कि इफ डू आई हैव द राइट आंसर्स आई एम द किंग, राइट? आज के ज़माने में इफ आई हैव द राइट क्वेश्चंस देन आई एम वन स्टेप अहेड. समझ में आ रहा है कैसा पासा पलट गया है? नाउ इज एन एरा ऑफ आस्किंग द राइट क्वेश्चंस. सो दैट्स रिलेटेड टू लर्नेबिलिटी एंड दैट्स व्हाई आई सेड इट इज देयर, राइट? एंड एक क्वेश्चन मेरे को आता है हमेशा इज मैडम आई डोंट फील कॉन्फिडेंट इनफ, तो मैं क्या करूं? Some of you all would probably have the similar question. I am trying to, because I have addressed B.Pharm students across different colleges. So this is a typical question. So I'm starting with this. After that, I'll leave it to you, whatever questions you have, so that this gets warmed up also as a question from you. So as pharmacist, look at it this way. Confidence क्या है? If I don't have confidence or I have lack of confidence, मुझे confident उतना feel नहीं हो रहा है, तो what is exactly confidence per se? Isn't it a symptom? है ना? Sometimes we misunderstand it as the cause, and as pharmacists you can appreciate this so much better. है ना? कब हमको confidence नहीं लगता है? When do we feel lack of confidence? And when are we nervous? When something is lacking, some skill is lacking, right? If I'm not a good communicator, I feel lack of confidence in coming and speaking, right? So the cause has to be identified. कि आपको confidence low लग रहा है, इसका cause क्या है? It can be a number of things. But addressing the cause is important, right? जैसे fever. If I just take paracetamol and stay on, sometimes probably काम चल जाएगा, पर long term नहीं चलेगा ना? जब तक मैं cause को नहीं address करूँ, unless I have addressed the cause, how will I be able to be more confident? I will do something today, I will wear a great suit and go, and I will feel a little more confident. Okay, so temporarily kerosene लेके काम चल गया. But unless I actually find out the issue that is giving me the lack of confidence and work on that issue, then only I will be able to feel confident ultimately. So identify what is it that you want to improve upon so that you feel more and more confident. Right? So that's one question of yours I've definitely answered. Many people, this question would have been there in the mind, saying that, how do I feel more confident? Okay, somewhere deep down, I have been in your shoes. I know how I have passed through B.Pharm from BITS Pilani and then gone on to do an MBA, then gone on to do a PhD. But there were at every stage, I had to address that cause. Without that, you will not be able to progress. So I'll take a pause here and ask for any questions. Unless you're extremely hungry, please go ahead and ask questions. Yeah? And I promise to give you in-depth answers, which will also give you more matter as we move along. Right? So ask me any questions that you have. I'm just trying to check up if there's something from here. See, one question also had come which I'll answer, the GPAT question, the NIPER and GPAT. Preparing for a competitive exam also requires a lot of effort, okay? And there are no right and wrong answers there. Competitive skilling is a skill by itself, right? So preparing for it, though we cannot stand and say, okay, do this, do right, but again, you have to have the spirit of approaching the exam with all confidence, with full confidence. Right? Only when you address your competitive exam with, who knows, you might want to give a GRE, you might want to give you want to do an MBA abroad, yeah? GMAT. So anything, for that matter, any competitive skilling would require the same approach of getting the right preparation and to give it all your 100%. है ना? मोटा मोटी यही होगा. इसमें और क्या ज्ञान दे सकते हैं हम आपको? अल्टीमेटली यही रहेगा. तो इसलिए मेरे को अभी बताइए कि what other questions are bothering you and I'll be happy to answer them.
Ma'am, you told us about spotting the problem.
हाँ.
So how to overcome the problem? That comes.
How to overcome the problem? भैया, this is like I think 365 days भी कम पड़ेंगे. You know, because unless can you give me a specific problem?
For example, me. I am the only first year student over here.
Okay.
And only student of Doctor of Pharmacy. So I am little nervous and.
You have done?
Little nervous.
Nervous, okay. हाँ. क्यों nervous? Again वही question आ गया कि आपको.
Because I am little.
Because you are the first year, only first year student, इसलिए आप nervous हो?
No, and the only student of Doctor of Pharmacy.
अच्छा. Okay, PharmD, yes. So you are nervous as to what your prospects will be, right? तो उसके लिए there is no pill that I can give you. Okay, there is no wonder pill, okay, which will give you. You will have to research the market. Market को जानिए. What is it? You look, see, it can be both ways. जैसे एक salesperson went to a place and saw people without shoes. And he said, जूते वाला, हाँ? तो जूते वाला वहाँ जाके बोला, भैया ये तो कोई जूता नहीं पहनता तो कैसे मैं जूता बेचूंगा? मैं नहीं बेच सकता. Or the other person says, wow, so many people bare feet. This is my chance to sell shoes. So it's the way you look at it. Glass half full, glass empty. There is no ready-made answers for you. ये offline भी हम discuss कर सकते हैं, पर कोई answer नहीं है. पर ये रखिए कि since you're unique, there would be some unique requirements which will be required in Manipal Hospital for that matter, or for that matter any other place where you could use your skills. खाली अपने आप को इतना बुलंद बनाइए कि people want you. Okay? Degree is a small part of you. Okay? Understand that. That's a very small, and I'm taking the liberty of saying that degree does not define you. You have to make yourself into a much bigger persona where people say, okay, what's your name?
Shri Vivek Zadhav.
बाप रे, विवेक बोलते सब?
श्री.
श्री, ओके. तो श्री सबको बोलना चाहिए कि श्री जैसा कैंडिडेट मिल जाए मेरे ऑर्गेनाइजेशन में, I will be able to then succeed more or reach greater heights. That is what is required. ठीक है? तो don't let your degree, influence what you are trying to feel. Sir, would you want to add to that? He's feeling a little jittery because of his, Pharm D and being, would you want to answer that? Yeah, just give a collar mic, not collar mic, sorry. A mic,
I think he entitled to do so because see, PharmD, as I understand, is a clinical pharmacology role in the hospital industry, not well developed as it, But then, as she said rightly, it's not well developed. That means the way you look at it, that means there is opportunity, That should you go forward and approach people, there's that many opportunities for you there, right? There are very few people now. Eventually, there will be more people as the whole thing develops. But right now, all you have is opportunities, so don't feel nervous.
There are huge opportunities. The sky is the limit. It's how you work around it. And that's for everyone, okay? Not just for Shri. Any woman who wants to add? Because I've specially told that women would like some words of encouragement. Speak up, speak up. Women need to speak up. Yes, there. Good.
Good afternoon, ma'am.
Good afternoon.
I'm Kaveri. So I just wanted to ask that in today's world, if we are doing something, there are some people who are fetching us back.
Pulling you back?
Yes, yes.
Okay.
And they are mostly our friends.
Okay.
So how to get over it or how to tackle that problem?
Okay. Sit down, sit down. What did you tell your name was?
Kaveri.
Kaveri. So Kaveri, I generally don't use personal examples, but let me use one here. मैंने बी फार्म किया बिट्स पिलानी से और फिर चूज़ किया कि आई डिड अ PS2. वी हैव समथिंग कॉल्ड प्रैक्टिस स्कूल 2 इन ये जो मैंने मर्क शार्प एंड डोम के साथ किया. एंड दे सेड ओके व्हाई डोंट यू जॉइन. आई डिड एन R&D प्रोजेक्ट. R&D डिपार्टमेंट में ज्वाइन करिए, वी लाइक यू. तो मैंने बोला कि नहीं सर, मेरे को सेल्स में काम करना है. सो दे वर ऑल शॉक्ड. इनफैक्ट माई फ्रेंड्स पुल्ड मी बैक बाय सेइंग पागल है, बिट्स पिलानी जैसे ऑर्गेनाइजेशन से किया है, वो बैग लेके घूमेगी तू भाई. नो 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 नो, यू टेक अ कुशी जॉब, AC में बैठो काम करो. ओके. सो then it becomes between me and my objective, my motive, right? So if I have my IDP, as we call, individual development plan, where we spoke about milestones, right? So if I have that later on in life, I want to do something which will make a big difference, like sir was also saying, is that you have to know the grassroots realities, है ना? तो सब लोग मेरे को पीछे खींच रहे थे कि मत कर यार. मेरे को अपने आप को स्ट्रॉन्ग बनाना पड़ा कि चलो नहीं, बैग लेके मैं घूमूंगी. ओके. इन द इंटीरियर्स ऑफ पूना आई हैव वर्कड एंड आई वाज अप्रिशिएटेड फॉर इट. ओके. सो अगर आपने कुछ निश्चय बना दिया है, ऑब्जेक्टिवली लुक एट इट, डोंट लुक एट इट सब्जेक्टिवली. My long-term goal was to get into brand management and move ahead, and that gave me an immediate success. I joined the, Danikar was saying 2 years, but after 1 year I joined into the product management team. I became the regional brand manager of the Western region. So women होके सोचो मत कि लोग आपको promotion नहीं देंगे. अगर आपने results दिया है तो promotion 100% होगा. Okay, I was sitting in a Nariman office, Nariman Point office in Bombay, and being the regional brand manager over there. Okay, तो जब आप decide करेंगे कि कुछ करना है, take objective feedback. There are people like I asked my professors there, I asked people who did well in marketing कि क्या करना चाहिए मेरे को, you know, ये experience count करेगा? बोले नहीं, जब तक आप अपने जूते नहीं घिसेंगे वहाँ पे आपका वो ठीक से you know foundation नहीं बन पाएगा. तो अगर वो चीज़ है, then I had to tell my friends कि sorry, I appreciate your viewpoint, but I'm sorry, I will want to get into that. Yeah, so that will always be the crab mentality जो हम बोलते हैं ना, वो रहेगा. Okay, try to look at everything objectively, take good advice, okay, unbiased advice, and that will take you further.
Yes, ma'am. Yeah? Thank you, ma'am.
Welcome. Now I'm trying to look at all the faces and see कितनी भूख लगी है.
Hello, ma'am.
Yes, hi. Where are you?
There is one question from Kishori Jadhav.
Okay.
How you guide the females to working in the pharma industry where all the female already facing the society typical mindset about the working woman?
Okay, so this is not very specific to pharma per se. I'll have to make it more broader, right? So एक meme भी circulate होता था कि men का जो path है रेस में दौड़ रहे हैं and women रेस में दौड़ते हैं ना. सब I can see some heads nodding. जहाँ पे women के hurdles ज़्यादा है and men के उतने नहीं है ना. तो क्यों हमने क्या ठाने लिया कि हम easy काम करेंगे? This person is sitting upstairs. Okay, so I am sure you can see me, and there is absolutely no reason why we cannot be stronger than men. So there might be hurdles. I used to do a program in SBI, like you would have heard, where I was helping women managers even at a leadership position in SBI where they were facing problems. So I cannot promise you a wonder pill or a magic wand which will make hurdles go away. What I can only promise you, Vaishali, right? Kishori, So Kishori, I can only promise you that you will have to make yourself stronger. There's something called empowerment. आप सबने सुना है ना? Women empowerment. ये तो buzzword बन गया था until some time back, right? So you have to. I believe the empowerment is power from outside. I feel women, and tomorrow being Women's Day, let me tell it out loud. I used to run a program called Women Empowerment, which means that the power comes from within. It doesn't have to be handed over to you. You have to create that power within to be empowered enough, I'm changing the word, empowered enough to overcome those hurdles. And you have shining examples of women who have done it, right? So Kishori, there are Indra Nui and plenty other people who you can keep as role models and see how these women have overcome their problems. So even for the women here, hurdles कम रहेंगे, ये promise मैं नहीं कर सकती हूँ. But I can promise you that if you power yourself enough, any hurdle will be absolutely cakewalk. Okay? तो आपको वो पावर ढूंढना है, एंड वो पावर अंदर से बेटर है. बाहर रुकिए मत कि कोई मुझे पावर देगा और फिर मैं I will be able to do a better job. So my request to all of you all would be, even men in this room, is that search for the power within to overcome the entire. In fact, Torrent में some time back they organized a Women's Day special where they didn't. Usually क्या होता है, most organization women के लिए होता है ना, which I did with Idea, it was just women. Torrent, fortunately, and I'm glad it's a pharma company, did a Women's Day with men also. And we did the entire program in such a way that we saw how women and men can complement each other and synergize to get better results. So a little help from men also is required, and vice versa. जब आप women को help करेंगे, they will help you back. Yeah? So if we can synergize together and create that power, the organization will do so much better. Okay, so I hope Kishori have answered your question.
Ma'am, there is one more question from Monica Kutte. How to increase the confidence and how to speak fluent English communication is the main barrier, and how to get out of it?
Again, Monica, no? Yes. Okay, on behalf of because of Monica, I'll tell all of you all, is that I know it's a difficult task, okay? I have worked in various states, and vernacular medium students do face a problem, and my heart goes out to them, okay? So I will not demean or say, ये तो चुटकी का काम है यार, all you have to do is make up. So it's a difficult task. And we spoke about vocabulary, we spoke about a lot of ways. In fact, like I mentioned just time back, I am trying to design an English course which is specially meant for pharma students. Okay? तो आपको भी क्या करना पड़ेगा? You will have to first work on the basics of language. So right from vocabulary, you speak listening. Now we somehow don't give listening enough importance. Listening as a communication skill is also extremely important. Okay, so listening skills improve. Watch a lot of debates in pharma which are in English. Okay, I'm just giving you one of it. Again, tips if I were to give you, I'll just throw a few here. Record yourself and listen to it, because that gives you, unfortunately we don't listen to ourselves. If you have enough feedback, people who can give you feedback, take feedback from them. Else, someone said presentation skills. The best way to know whether you're doing the right presentation skills is by recording yourself and hearing it. Right? So do all of these tactics which will help you. And LinkedIn, I don't have a PowerPoint slide, so I'm available on LinkedIn. You can reach out to me there. We can always, communicate and try to see how we could probably, from time to time I could give you some tips or techniques and things like that. It's a big world by itself. So improving a language is not an easy task. And it is, like I said, LSRW. Listening, speaking, reading, writing. Reading is very important, as was touched upon, which we are saying, today's readers make tomorrow's leaders. ये सुना होगा आपने, और जिन्होंने नहीं सुना है, it's a very important part. So all these four, LSRW, has to be addressed in any language proficiency improvement. कल को अगर मेरे को कन्नड़ा भी सीखना है, तो मुझे भी वो ही करना पड़ेगा. तो English is just another language. Right? So we have to work on that and improve it to a minimum level. We don't have to get into a very high level of, we don't need to speak like, the best speakers of the world, but you have to make your point heard and you have to make an impression. So that bare minimum proficiency comes from various ways, and there are various techniques, tools, applications, YouTube videos, there are plenty that's available. Make the most of it, and if you still feel stuck, please reach out to me. We can always help you.
Ma'am, there is one more question from Albina Pathan. Ma'am, what can you say about women doing as MR job, as some people advise her to not go for this profession?
When was this question asked? Was it after or before I already said? Okay, I'll still say कि yes, अभी थोड़ा ज़माना बदल गया. मैं बात कर रही हूँ 1991 में, where women as MRs was completely, said why? Kind of a thing. Abhi things have improved, and believe me, that's the best education in pharma that you can get. Okay, that grassroots level experience prepares you for the best in the pharma industry. Okay, and I'm sure the speakers here will agree with me, is that even if it's a bitter pill, chalo pakad liya ki life is not going to be easy as an MR. Okay, theek hai. Even if, and it's not that bad, it's very enjoyable. You're meeting doctors, you're speaking to them, you're going to different places, you're enjoying. It's a fantastic job by itself. Without getting into the nitty-gritties of the job per se, what I'm trying to say is that you will learn a lot. So even if you feel कि there might be one day where you said, oh God, I'm so tired as an MR, मैंने क्यों ये MR लिया, है ना? कभी-कभी ये भी हो सकता है. It will keep you and put you at a much higher level so that your rest of the pharma career becomes so much easy. आप बताइए आपका सैलरी, पगार कहाँ से आएगा? कहीं भी आप फार्मा में कहीं भी काम करिए, आपका सैलरीज कहाँ से आएंगे? सेल्स में से. और सेल्स में कहाँ से आएंगे? वो डॉक्टर पर्ची लिखेगा तभी तो आपकी दवाइयाँ बेचेंगे ना आप. वो बिकेगा, उसके बाद आपकी सैलरी आएगी ना. So ultimately, that's called the moment of truth. Ultimately, so agar you know that firsthand, if you understand that firsthand, everything else in the pharma industry is working for it. आ रहा है समझ में? Clinical trials भी पकड़ के चलिए आप. Ultimately क्यों कर रहे हैं आप? कि ये दवाई जाके बिके ना. right? So if you have that as the first hand experience, everything else becomes so much clear. All the options and how they culminate to your company doing well in the market becomes clear. आ रहा है समझ में? So that's why it's called the moment of truth. तो उसका अगर experience हो जाए तो you're set for a great pharma career. So don't worry about it, and no job, believe me, if you feel any other job is cushy and fantastic, it's so simple, no job will be simple. There's a word called emotional intelligence that we use, okay? I have had people who have worked, like I was telling you, the IP team, where they are also facing a lot of emotional distress. So no job is going to be zero hassle or zero hard work or zero problems. Every job will have its set of problems, and grass is always greener on the other side. Okay, so don't think of it that MR job is something that you need to struggle. Like I told you, it's an excellent job, and it will keep you in the focus of how the pharma industry works. But no other job is also very cushy. Every job will have its set of challenges. Challenges, I can promise you. Smooth sailing, no. That's how it is.
Thank you, ma'am.
Thank you so much. Thank you.
Thank you so much, ma'am. The session was really interactive, and you have made us understand that how soft skills are an important tool, a weapon for all of us, and how we should use it efficiently. Thank you so much, ma'am, once again. Now I invite Head Placement of Lotus Business School, Mr. Vivek Keskar, sir, to propose a vote of thanks.
Good afternoon. I'm not going to take much of your time. I know all of you are hungry. I'm also equally hungry, but I think you are equally hungry for your career, right? So we are already on the half day, and I'm here in front of you for vote of thanks. But before that, I just talk about two things and then a formal vote of thanks from my side. Being a person from training and placement, I think audience like you is an ideal thing for me to happen. But okay, I'm not going to take much of your time. Basically, such kind of events, why we arrange, the objective of our MBA or application-oriented education itself is to make you employable. Because going through the process, you will become mathematically, you will be eligible to sit for interview, obviously. But obviously, the objective of the whole process is to make you employable. So such kind of programs are always useful for us and for students to become a more productive, more efficient, or more capable person with respect to delivering on ground. Because at the end of the day, as far as academics is concerned, the main stakeholder is industry. So today we are lucky that we have people from industry, that too from pharmaceutical industry, specifically for you. I know all of them are really very busy, and they have taken up their time for guiding you. It is out of their own interest. And you had gone through the process, you are on the other side of the coin to listen to them. You must have understood what goes into it. Now, this is the first reason. Second thing is, obviously, I am in training and placement for almost more than 20 years, and I'm just going to tell you one small mantra for success, as far as success in any domain is concerned. The small mantra for success in any domain is nothing but try and understand your passion, follow your passion, and convert it into profession. Convert your passion into profession, that will give you satisfaction throughout your life. Obviously, there are so many angles, so many shades. I cannot talk about it because of the time constraint. But introspect yourself, try and find out what kind of person you are. Try and look into your background with respect to your socio-economic background, and then look into the real life and try and bridge the gap between the expectation of the industry in respective domain and what you carry as a human being within you. Certificate qualification is one part of it. It is not the end of journey. It is just beginning of the journey. So I hope you, all of you are taking genuine efforts. That's the reason you are there in such a huge crowd. So these are the two things I think I thought I must talk to you. Now, as far as the most important part is concerned, thanking all of you obviously. I must thank Anand Bote sir. I must thank Prashant Danekar sir. I must thank Dr. Shoma Srivastava madam for taking out their very time in from their busy schedule, investing in you and guiding you with their life experiences. All of them are now working at very senior position, but at one point of time they started their journey from scratch. So they themselves are leading by their own examples. So I must thank all of them. And in post-lunch also there is going to be so many other events I know. So I must thank all the delegates, all the keynote speakers for this event. I am thanking them from my bottom of heart. I am thanking them on the behalf of Lotus Business School. Secondly, I must thank our trustee executive director Charudatta Bodhankar sir. Because of some busy schedule, he is not there physically today, but he is a consistent motivation for all of us. So I must thank Charudatta Bodhankar sir as well. I am thanking Dr. Varpade sir, who is a leader for all of us, and he is the kind of leader who motivates consistently for all of us to execute such kind of functions. And you are just seeing the example. So the reason behind the whole activity like this is Dr. Varpade sir. So I must thank Varpade sir from bottom of my heart. I will equally like to thank my all faculty colleagues, teaching, non-teaching staff. Because of their consistent efforts, we are doing such kind of events. I am thanking all the principals, faculty members from the institutions across Maharashtra. And last but not least, I'd like to thank all of you for your huge response to the event like this, your patient listening, and your active participation in the process of the whole delivery of the session. So once again, thank you all of you. Thanks a lot. Thanks a lot. Thank you.
Now I request all the students, please be seated here only.
Now there will be one QR displayed on the screen, and you have just scan through it and share your feedback about today's conference. Also it will be like your attendance. You have to mark your attendance through this so that you will get the certificates. If anyone is facing an error, then you may convey it to the nearest volunteers.
Okay. Now get set for some exciting competition ahead. We have got the business plan competition and poster present competition lined up. It's your chance to shine and share your idea with everyone, and get ready to participate with enthusiasm and showcase your talent and idea with the forward.
But before we begin, now I would like to invite Durga and Apeksha to inform you about the rules and regulations for the further competitions.
Good afternoon, everyone. Firstly, moving towards the poster presentation competition, I would like to put some light on evaluation parameter of poster presentation competition. The rules are, each team will consist of maximum 2 participants. The poster should be original and handmade. The participant will be given a maximum of 3 to 5 minutes to present their poster before the panel. The official language of the poster will be English. Decision of the judges and committees will be final. Judging parameters: overall visual appeal, ability to stand alone, appreciate and relevant content of theme, innovation and creativity, oral presentation of poster. We have honor to have judges of poster presentation competition. They are Devendra Visokar sir, Preetam Nikam sir, Rakesh Kumar sir. Thank you.
It's indeed a beautiful day where the best minds will drop knowledge bombs and share intriguing insight. I'm Durga Talevar and I am here to inform you all about rules and regulation of business funda competition. So let's start with the rules. Each team will have only 10 minutes to present its plan before the panel, followed by a 5-minute of question and answer session. A warning bell will be ringing after 8 minutes. Each presenting team will have approximately 5 minutes for setup. Each member of the team present at the competition must participate fully during the formal presentation of the plan. The judging criteria are uniqueness of the concept or business idea, clarity and concepts of the proposed plan, quality and usefulness of product, service or solutions, market opportunities and competitions, the financial or social return of the proposed venture, the marketability of the proposed venture, features of the product, sources and solutions, market opportunities and competitions, USP of the product with future forecasting, financial management, pitching. The decision of the judging panel will be the final. The judges for the business funda competition are Dr. Shoma Srivastav ma'am, Dr. Ajay Shinde sir, Dr. Sunil Harer sir. Before we begin, now we will be having a lunch break. Lunch is being arranged downstairs. Let's meet at the library for the poster presentation competition at 2:30. And other will meet at the same place for the business funda competition. Thank you. Now you may proceed in the group of 10.
Okay, have you scanned this QR and have you submitted the feedback? Okay, so that submitted window you have to show at the end while collecting your certificate. Okay, you will not get certificate right now. After the end of today's program, you will be getting your certificate, and at that time you have to show the screenshot and then you will get the certificate. Okay, so lunch arrangement is done in the parking area. You can proceed for lunch.
30s and 40s and already
If there is a student of poster presentation competition, please raise your hand. No. Okay, then. Good, Good afternoon, everyone. Welcome back. I can see all the excited faces. So let's start Business Funda competition. So I request all the groups to be ready with your presentations. The first candidate is Shri Vivek Zadav. Please come on the stage for the presentation.
Hello. Hello. Good afternoon, all respected judges. Myself, Shri Vivek Zadav, first year student of PharmD from Nashik. My today topic is ABM. ABM stands for Apla Bharat Medical Card, which is invented by me. India's healthcare system has been plagued by paperwork and error. 5.2 million deaths are occurring due to error in the healthcare system of India. So now the question arises. Now that I have given first line. No, sir. My topic is ABM, Apla Bharat Medical Card, which is invented by me. A step forward to digitalization of India. India's healthcare system has been plagued by paperwork and errors, which has resulted in millions of medical errors each year. According to a study by Professor Jha at Harvard University, Indian experience 5.2 million medical errors annually. I have invented a card, ABM card, just like as our chief speaker had told us about a card invented by the digitalization of India. It is same like this, but this card not only focus on recording patient history, it also focus on reducing the error in the healthcare system of India. Now the question arises, how it will it decrease? We are introducing an AI system over in this card. It is same by you can use it by numbers or by slide or by using the QR code. So what a card does? If a patient is having a allergy, this card is mainly for pharmacists. If anyone is going to pharmacist and the patient is diagnosed or as allergy by some Zol group, what happens? Many medicines contain Zol group. So if a pharmacist provides the Zol group medicine, the patient intakes it. What happens? ADR shows. So our card mainly focus on reducing the error. It also focuses on showing the data to the doctor, pharmacist, and the patient itself. This is the overlook of the website. This is the opening slide. There will be 3 options given: doctor, patient, and pharmacist. The patient, on clicking the patient site, he or she has to enter the ABM number and its password. Then what happens? The doctor name, reason of diagnosis, and when he has went to the doctor and medicine prescribed by the doctor is displayed. Then doctor side. it also helps the doctor to organize the patient list and organizes details about the patient, past patients and their diagnostic result. New patients. Then pharmacist side. Now here they will be there. Now the main focus of this my card, my own plan or my own thinking is every pharmacist must use this card so that many a times, as you know, AMR is the leading cause. Everyone knows that AMR. AMR is the leading cause of many deaths. So what happens in the rural area or in the many pharmacies, they continue to give medicines which should not given without the prescription, but they continue to give it, which is a major cause. Like antivirals and antibiotics, they have a limited and a proper rule is given by the WHO and Indian guidelines. But what happens? Patient asks for the antibiotics, the pharmacist give them, and AMR is occurred. Thank you.
Question answers?
I created this card.
This is the product descriptions. Where is business?
This is the product. This is the card. When people are using, they are of course going to use money.
How you are getting money from this?
By using the card. YouTube, आप वीडियो देखते हो, वीडियो में अपन थोड़ी पैसे डालते हैं, but actually main focus is not money. Main focus is I am a pharmacist. My service is to patient. So to avoid the debts, not every business is about money. Many businesses about. But I am not thinking of that way. But I am not thinking of that way. My in one conference at Nashik, one speaker told me, if I am a pharmacist, my only customer is patient, and my only service will be to the patient. So that is my goal. Yes, sir. So under your guidance, we can of course earn money if you give your hand.
Even if this is a social project, are you thinking of it as a social project?
Yes, sir.
Okay.
Yes, ma'am.
You cannot go endlessly without funds.
Yes.
Okay. Either you
I'm
will
running
have
this. Means I have already prepared the card. I have created this project 4 to 5 months ago, and I am in the middle of developing the software with my own expense.
So, agreed. So you cannot go on this forever, right?
Yes.
Somewhere you will have to make some money.
Yes.
Okay. Or you will have to get funds.
Yes.
Dono mein se ek, right?
Yes.
So for that also you have to plan.
Yes.
So that planning is
Actually,
missing.
if you're thinking of money, I also have a plan of for making money.
No, even if it's resources,
Yes,
your time is money.
Yes.
Okay, so when you're thinking of resources, either you have to get resources from somewhere.
Yes.
Otherwise, खाने पीने के बंदे हो जाएंगे ना.
Yes, yes.
Correct. So
Ma'am,
इसलिए
if we develop this card more enough, and if we are seeing practicing of this card, actually. You can see after through 4 to 5 months, it's my guarantee. In my rural area, I'm going to start using this card in one of my doctors, Mr. Chavan.
Dr. Chavan.
Yeah, Dr. Chavan. In this hospital, I'm going to start this. I already talked with him. He said it's okay. I want to create this card and influence it so much that it should go into government, yes. And maybe if they wanted to buy, I can.
So you need a sponsor,
yes,
some
yes.
form of sponsor, right?
Yes, yes.
So that's what we are trying to say. Have you thought it through? That was our reason. That
I
we
only
asked.
thought of serving the patient and nothing else.
You have to
Money
look
was
at
not my
all
plan.
angles, all angles. Anyway, thank you.
Yes, sir. Yes, I already compared. Yes. आयुष्मान कार्ड इज मेनली फोकसिंग ऑन इज द स्टार्ट. सो स्टार्टिंग में उन्होंने कहा कि हम लोग इंश्योरेंस देंगे. वो इंश्योरेंस का भी डेटा ऑलरेडी आई इट सेकेंड स्लाइड मैंने उसमें डाला था कि ये डेटा भी बताएगा. यस यस मैंने वो कार्ड खुद देखा था. मेरा रजिस्टर है उसमें, मेरे भाई का भी है एंड माय वहीनी संपन है. सो उनका एक एक्सीडेंट हुआ था, उनमें मैंने उनको कार्ड यूज करा था. सो डिडंट गेट एनी मनी विथ माई नॉलेज, क्योंकि मैंने जब उनको इसीलिए उनको कार्ड इंट्रोड्यूस किया था ताकि एक्सीडेंट हुआ था और शी वॉज प्रेग्नेंट, तो तभी काम आएगा. एरर टू रिड्यूसिंग एरर इन द हेल्थ केयर. आप सब ने स्पीकर आए, सब ने ब्राइट साइड बताया. नाउ इंट्रोड्यूसिंग डार्क साइड एंड हाउ टू रिड्यूस द डार्क साइड. इफ देयर इज द लाइट देयर इज द शैडो. हाँ. Yes. 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 So, according to speaker ने भी उतना ही बताया कि वो सिर्फ हेल्थ सिर्फ रिकॉर्ड करेगा पास्ट हिस्ट्री, ADR एंड नथिंग, उसका कुछ बताया नहीं था. और अकॉर्डिंग टू माय सिस्टर आई डिडंट गेट इट. यस यस सब. सर क्या उसमें लिखा है कि फार्मासिस्ट भी एंट्री कर सकता है? यस 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 इट्स अ टाइम एंड रेस. यस यस. सो मेरा ये कार्ड आपको जैसे बताया था फार्मासिस्ट के लिए मेनली. आप फार्मासिस्ट के पास जाओगे क्योंकि फार्मासिस्ट उतने दिल के अच्छे नहीं है, वो भी पैसा देखते हैं. उनको प्रिस्क्रिप्शन रहे या ना रहे, दे विल प्रोवाइड द मेडिसिन. सो जो मेडिसिन आ रहा है, जो डिस्ट्रीब्यूटर से मेडिसिन आ रहा है, हर एक मेडिसिन का रिकॉर्ड होना चाहिए कि कौन सा मेडिसिन कहाँ गया और किसने प्रिस्क्रिप्शन किया था तब गया. अगर विदाउट प्रिस्क्रिप्शन अगर गोली जा रही है, क्योंकि जा रही है, मैंने खुद ली है. रेड वार्निंग का एंटीबायोटिक्स में रेड लेबल करके वार्निंग आता है कि 2 to 3 days ही ले सकते हैं और विद प्रिस्क्रिप्शन ही गोली ले सकते. बट फार्मासिस्ट दे डिस्ट्रीब्यूटेड विदाउट द प्रिस्क्रिप्शन, तो वो रोकना है. Yes. So, but they are dispensing it, na? Yes, OTC. Yes. Sir, but if a patient is continuously buying paracetamol or any OTC, ADR तो शो होने ही वाला है ना. तो अगर कंटिन्यूस बाय, अगर वो मेडिकल वाला थोड़ी देखने वाला कि कंटिन्यू बाय कर रहा है वो. एंड देयर वाज वन मोर टॉपिक. यस. तो वही बताना चाह रहा हूँ मैं आपको. सर मैं यही बताना चाह रहा हूँ कि जो फार्मासिस्ट को डिस्पेंस कर रहा है वो जो हर मेडिसिन, उसका एक रिकॉर्ड चाहिए. थैंक यू सर.
Thank you. That was a very good idea. There are few new candidates in the hall, so I am repeating the rules of business funda competition. The first is each team will have only 10 minutes.
See, the shorter the presentation, the more competent you are. So you will present in 5 minutes, and additional 2 minutes can be given to you in case you want to make a valid point and move ahead. The rest of the time will be for question answers. We want to keep more time for the question and answers. Is that okay with everyone? Yeah? Okay.
Now I request second team Manas Joshi and group, please come on the stage for the presentation. So The next team is Ganesh Prajapati and team. The next candidate, please come on the stage for the presentation.
Hello, I'm audible? Good afternoon, everyone. My topic name is Spirulina, a nanomedicine approach to a cancer. How many of you heard about Spirulina in pharmacy or in ecology or in medicam? How many of you heard about Spirulina? Introduction. Spirulina is a multicellular and filamentous blue-green algae belonging to the genus Arthosporosis plantaceus, and mostly we use Arthosporosis plantaceus for our medicine preparation. Spirulina's uses are fight with allergy, boost the immunity, support the weight loss, and lower the cholesterol level. The main reason to bring this topic in the business funda is to increase the agricultural production and to make the farmers more richer than nowadays. Sir, can I speak in Marathi? Okay, sorry. Mainly cultivation of spirulina is done in a tank or a pond which is made up of 10 into 20 feet size. We have taken 20 such ponds. In each pond, on an average of one day, it gives 2 kg wet culture. The farmers should understand the equation. 1 kg of wet culture will give only 100 grams of dry powder. On the basis of 20 tanks, we will get 4 to 5 kg of dry powder per daily basis. If we sell the 4 to 5 kg of dry powder to the company which is making the tablet of spirulina using the extract of spirulina, it will give 1,50,000 to 2 lakh rupees per month to a farmer who is harvesting the spirulina. If we want to increase the profit, then the investment will decrease in the following types. In a way, to make a concrete tanks or a pond, we can use a durable plastic sheets to reduce the cost of concretes and cement bricks. These are some capital investment costs. Pond construction, 20 ponds we have taken on an average 20 ponds, 30,000 rupees per pond. It will cost 6 lakh rupees. Plant and machineries, agitator is used for mixing the spirulina and drying. Dryer, tablet compression machine, it will cost 2,90,000 and 30,000 rupees. Laboratory equipment such as chemicals and so on, it will go to 5,000 rupees. Water treatment, because the spirulina is working capital, this cost goes around 80,000 rupees, in which labor, electricity, branding and advertisement, packaging material, chemical, cultural, all includes, it goes to 80,000 rupees. Now, if we prepare a tablet of 500 mg, in each bottle contains 90 tablets, and the course actually goes on till 1 month. From the 150 kg of spirulina, we will produce 300 bottles. One bottle cost is 1,000 rupees. The 1,000 rupees cost is because of I am a pharmacy student. I know that if we take 1 kg of spirulina, it will give only 100 grams of dry powder. Why? Because extraction, this much amount of spirulina we get, and we will only get this much amount. That's why the price is so high. If we deduce the working capital with income, we will get to 2,20,000 per month, and we will deduce the taxes or expenses from that 20,000, 2,20,000. Finally, we get 1,80,000 rupees. Return on interest means अभी मैंने एक कंपनी में पैसा लगाया, मेरा कितना लॉस और कितना प्रॉफिट हो गया, उसके रिलेटेड और रिटर्न ऑन इंटरेस्ट है. रिटर्न ऑन इंटरेस्ट हमको एक 1 ईयर टू 4 मंथ्स में 15.81% रेट ऑन इंटरेस्ट है. इसका मतलब क्या हो गया, जो एग्रीकल्चर करने वाले, हार्वेस्टिंग करने वाले हैं स्पाइरुलिना का, उनको 15.81% प्रॉफिट होने वाला है. इसका ये मीनिंग है रिटर्न ऑन इंटरेस्ट का. मार्केटिंग डायनेमिक्स में फंडिंग कहाँ कर सकते हैं, बैंकिंग एंड फाइनेंशियल इंस्टीट्यूशन, सब्सिडीज फ्रॉम गवर्नमेंट, ओन फाइनेंस. अभी सबसे ज़्यादा कॉम्पिटिटर इस स्पाइरुलिना का टैबलेट बनाने में सबसे ज़्यादा कॉम्पिटिटर कौन है? डाबर, पतंजलि, एम्वे, वेस्टीज आर द बिगेस्ट कॉम्पिटिटर इन दिस साइड. मार्केट पेनिट्रेशन एंड फ्यूचर स्कोप हम हमारा जो स्पाइरुलिना का टैबलेट है हम कहाँ देखते, हम अमेजोन और फ्लिपकार्ट पे भी सेल कर सकते हैं, और उसके बाद सीडीसीओ का फॉर्मेलिटीज पूरा करके फॉरेन कंट्रीज में भी हम सेल कर सकते हैं. Conclusion, spirulina is not only used in the treating cancer, it is used for boosting the immunity and all that. Thank you.
So, what do you think that you can sustain in the market by consideration of the existing companies for the similar product, that is Patanjali and others, Dabur?
Sir, see, basically, कभी भी हम कौन सा भी इन्वेस्टमेंट या कौन सा भी स्टार्टअप करते, पहले हम दूर का नहीं सोचते, जहाँ हम पहले कितना सर्वाइव कर पाते उसका सोचते, फिर नहीं क्या. अभी डाबर और पतंजलि बहुत बड़ी कंपनी है, हमें आप जस्ट स्टार्टअप करने का है, जस्ट अ बिजनेस स्टार्टअप.
ठीक है ना, लेकिन बट आफ्टर स्टार्टिंग योर बिजनेस यू शुड सस्टेन इनटू द मार्केट. नो,
yes sir,
after span of 1 month or 1 year you are not closing your business.
Yes sir,
you have that much vision before to begin your business. You should have that much vision so that you can sustain into the business, into the market as compared to the existing companies of your similar product, isn't it? So what is your strategic plan to remain sustain into the
सर फॉर एग्जांपल अभी हम 5 फार्मर से एक डीलर पूरा स्पाइरुलिना का ड्राई प्रोडक्ट कलेक्ट करेगा.
see stick to the product itself, spirulina,
yes,
yeah, that is it. Don't move here around.
नहीं, स्ट्रैटेजी पतंजलि और डाबर से कॉम्पीट करने की स्ट्रैटेजी बता रहा हूँ.
प्रोडक्ट एफिशिएंसी बोलनी पड़ेगी आपको, आपका प्रोडक्ट बेटर कैसे है as compared to the existing product.
बेटर वो डायरेक्ट विदाउट केमिकल और विदाउट डाबर और थोड़ा सा
डाबर और पतंजलि, they are what do you think, they are mixing their other ingredients?
No sir, 60-40 तो रहता है. 60% हर्बल और 40% ऐसा मिक्सिंग रहता है उसमें सब में.
See, I am a pharmacist.
Yes, sir.
Keep in mind. ठीक है. So as compared to the Patanjali or Dabur, if you are claiming that they are mixing the other chemical ingredients as like preservative, keep in mind. बराबर है. So how do you stand? This is my basic question.
Sir, by improving quality or reducing the cost.
One thing. Second one, what kind of the part of the plant you are using? Spirulina.
Orthoporosis.
Part of the plant you are using.
Sir, वो अभी वो ड्राई पाउडर मतलब वो ग्रास रहता है ना.
Yeah, whether you are using the leaves, stems, roots.
Leaves, dry leaves.
आपको पार्ट भी पता नहीं चल रहा है, ठीक है?
नहीं, dry leaves.
ठीक है. दूसरी बात, have you investigated the actual constituent available into the leaf is responsible for producing the activity? How do you claim your activity that is reducing the cholesterol, body weight, each and everything?
Basically spirulina में chemical constituent कौन से enolic acid वो सब spirulina में जितने
So have you compared your product constituents with the present existing into the market? This is my question that I started with the first.
Comparison.
हाँ, वो चाहिए ना. बिजनेस में पहला कंपैरिजन आता है. आपका सिमिलर प्रोडक्ट है. Yes or no?
Yes, sir.
Then,
sir, I have
by considering the cost benefit.
Sir,
have you analyzed cost benefit with your existing product?
Cost benefit sir, पतंजलि और डाबर का थोड़ा लो है. मतलब अभी
उनका लो है, आपका ज्यादा है. So why should I purchase?
Sir, because
because
quality matters na.
So that is you will have to prove no what is your quality of your product as better to the existing.
Yes.
Sir, you understand my question or not?
Yes, sir, I understand.
Sir, fine. Thank you.
Good attempt, Prajot. One sec. Just to add to what sir said, see, just to understand, if you're first तो डाबर का spelling wrong है तो वो एक बार check कर लेना. Second is जब आप marketing cost रख रहे हैं ना, when you're keeping marketing, you have kept only 10,000. Actually, you understand that if you're facing the competition from such big giants, you'll have to do a little more investment in marketing, no?
Yes, ma'am.
है ना? So you will have to, even if to tell people that your quality of the product is good, you have to spend for that. Right? Yes. People will not know by themselves. So you'll have to market that your USP is that your quality is better or whatever. So when you're planning, you have to think of all of those when you're doing it. Okay? Yes, you have understood? See, think of this as a learning experience also. The reason we are trying to help you think is that going forward, you're able to think better.
Yes.
Right? Rajat, have you understood what we are trying to say? Okay.
सर बिजनेस प्लान आपने जो वो सब मेरे को सर आपने वो क्वालिटीज वगैरह मेरे को सर आपने जो मेरे को क्वेश्चंस पूछे उसमें से मैंने ना जो हमारा बिजनेस प्लान जो फॉलो करते हैं ना जो फार्मर से उनसे हमने ये पूरा बिजनेस प्लान सेट करके लिया था. अभी वो क्या करते रॉ मटेरियल किसी को तो बेचते इसलिए उसने पूरा इंफॉर्मेशन नहीं दिया. मतलब ये बिजनेस प्लान हाँ यस सर that's why sir.
Okay, all the best.
Thank you. That was a really good idea. And the next team is Manas and Joshi. Please. Sorry, Manas, Joshi and team.
So, hello. Good afternoon, everyone. So, I'm here with my business plan, which is known as Satwa, nutrition with tradition. That's our tagline. This is an initiative by our college and by our students, our classmates, to improvise and to develop nutraceutical products in college while doing our years like semester. We have came with the Satwa product. So basically, what is a Satwa? Satwa is as I say, it is an initiative by our college, and then Satwa mainly focuses on the trees and part of trees which are generally neglected by the society and unexplored properties. So to demonstrate this line and to demonstrate these things, I would like to show you and to test you our products which we have made in our college itself. So, ma'am, which one you are having are the jellies made up from dragon fruits and dates. So, yeah, ma'am, and in the ball, yes, ma'am, it is made up of dragon fruits as well as the dates. Then we have in the bowl that are protein bars, which is made up from the household flours which we use, like sattu, nagali satwa, wheat, and then many more like that. Kurid, if you know. Then we have that jam over there, which is kadamba fruit jam. Kadamba is a fruit which is rich in antioxidant properties and everything. I think my friends will explain you more about it and will next talk to it.
Hello, ma'am. Hello, sir. This jam is made from the kadamba. This jam made from the kadamba fruit. Kadamba, that is Neolamarchia kadamba. Basically, people ignore this fruit and plant because of their horrible appearance, and also we see towards this plant as an ornamental plant. But this fruit kadamba is traditionally very important and also used to reduce fever, anemia, and also diabetes. And many tribal peoples are use the juice of its fruit to reduce gastric irritation also. Various chemical constituents are present in it, like flavonoids, majorly found in it, and due to this, it acts as an anti-cancer agent, antiviral agent, and it has a property like wound healing property. And also citric acid present in it, and also vitamin C. That's why it acts as an antioxidant agent, and various chemical constituents like saponins, glycosides, and flavonoids also present in it. So this jam is very useful to all of us.
And ma'am, as you know, proteins are the main factor for the immune boosters. So the proteins bar, this is our first attempt for making the protein bars. And then we have the jellies. So ma'am, if you have any questions about the taste, about our satwa and everything, you can totally ask us. And there is one more thing I would like to add in our kadamba fruit jam. It is, we recently found peppermint in this kadamba fruit. We are open for the questions.
Is it over?
Yes, sir, please.
Fine. See, we have now 3 formulations.
Yes, sir.
Okay, one is a jelly, second one is a jam, and third one is the
Protein
chocolate.
bars. Protein bars, yes, sir.
The chocolate bar it is.
Protein
I can
bars.
say. As its appearance is like a chocolate, that is why I would say better is a chocolate bar.
Okay, sir.
Providing more protein to the after consumption.
Yes, sir.
Okay. The one basic question as like sticking to your concept of satwa.
Yeah.
So satwa principle is applicable to all these 3 types of formulations?
Yes, sir. All these are patient compliance, it is patient friendly, it is cost efficient, and as well as it is, we can give it to all kind of patients except for those patients who are unconscious.
Okay, the second one is about the nutraceutical purpose.
Yes, sir.
Isn't it? Nutraceutical concept is applicable to only, I think, the jam and the second one, that is jelly.
Yes, sir.
Not to the protein.
So protein bars, even though it has chocolates, it has kurid, it has sattu, which is also known as sattu. It has proteins, it has omega fat. Sorry.
You added there into the bar?
Yes, sir.
Bar.
Yes, sir. The base, if you eat it, under the chocolate there is a bar which is made up of these flours, wheat flour, a little bit of salt, sattu, which I've added, nagli satwa and everything. It is rich in flavonoids.
So how it is helping in medicinal aspect?
So it is basically, as I said, it is rich in protein.
Only specific to the bar.
Protein
chocolate
bars.
bar.
Okay,
Yeah.
sir. So as I said, it is rich in protein, as you know. It is dipped in chocolate, melted chocolate, dark compound, which has less amount of sugar and more 55% of cocoa beans.
Okay, okay.
So it is
fine,
also
fine, it is okay. There is no problem. See, this the discussion related with the benefit to the patient.
Yes, sir.
In consideration of the medicinal as well as theoretical concept.
Yes.
Okay, it is only the theoretical discussion. So in consideration in the angle of the business.
Yeah, sir. I will explain it also. Sir, in market there is as same as the last presentation, there are few companies which are leading in nutraceutical businesses. Yes, sir. It is totally safe.
Madam is supposed to
yes,
eat
yes,
this.
sir. We have done the market survey. We have tested it to 50 more people, and they are still alive. Sorry, ma'am. How long have you studied the longitudinal? Ma'am, we have been studying it for a month. Like the jam, we are.
तो month के बाद फिर चले गए तो?
No, ma'am. They are still, sir. They are still here, and they will be living a good life and a healthy life. Don't worry about it. That's why we are planning to do the nutraceutical to enhance the lifestyle and enhance the healthy lifestyle, we can say. That's our tagline, nutrition with traditions. These are the traditional medicines which are there in Ayurveda, Charak Sanhita and Shushrut Sanhita as well. Even if the Kadamba fruit I mentioned, the Kadamba fruits mentioned, it is in the Shivatandav Stotra, Kadamba Kumkumadrava Pralipta Digvadhumuke. That is there.
So you said that's good for diabetes, right?
Yes, ma'am.
So how did you add sugar to the product?
Yes, ma'am. Yes, I'll explain it. First of all, the jam is our prototype, and we are still making it for the diabetic patient as well. We to substitute the sugar, we have added some date powder. Then we have added some.
This one has sugar?
No. This has sugar, and this is mainly for we are right now capturing kids. That is our main what we can say patients. Yes, ma'am. Age
Target
group,
audience.
target audience is our children's, because what we think the children should get the benefit more than the patients. But right now we are working on it. We have added like licorice powder to increase its sweetness. Including the chemical factor, we can add mannitol as well, which doesn't involve the insulin, etc.
No, but again the same point of sirs, that you have given us the product features and benefit. Where is the business plan?
Yes, ma'am. For the market, we can go through the market, and we will see if we consider the protein bars, if we consider the jellies, if we consider the jam as well. Basically, if we go in the market, jams are around 80 rupees to 110 rupees for that kind of jar, like 200 grams or 150 grams. So we are providing this jam, which is more beneficial than the other jams. Like, so can we mention the companies like Kisan Jams or some Maggie's Jam, etc. This jam is more nutraceutically or more health beneficial. Then it is more cost effective, because the jams, as I told, 75 rupees to 110 rupees. This jam is available only for the 60 rupees, same as the jellies. These are around same value as the dragon fruit. Dragon fruit is available around 75 rupees for one. And this jar. Yes, sir. We have considered like several jams which are available, several jellies, as well as the protein bars. If you go for the protein bars, there is a packet of 6 bars in one wholesale pack, and it is around 350 rupees. But this one bar is, you can get it for only for 45 rupees, and which will be more in the size, and which will be more beneficial and more tastier. Yes, sir, these are giants, but we can try to compete with them. On a starting point, or on the point of starting it up, it is always there are huge giants in front of us. But sir, by following Prabhu Shri Ram, we can fight with them. And sir, if we, what our thinking is, this is our initiative, and we can say, our thinking is like, if we go harder and we are not, any kind of preservatives are there, no kind of artificial flavors are there, and no kind of any, we can say, substitutes for the any ornamental thing is there. Everything is real, everything is nutritious, and everything is all good. Just like these company, if they can, we can as well.
ये थोड़ा philosophical हो गया. I want hardcore facts. You all should have an Excel sheet saying this is what is it, this is how we are going to, we do.
Society. So a little bit of philosophy is also mentioned in the market as well. Target some audience.
No, this is smart talk, but we want hardcore work. Any more slides are there?
Yeah.
Show us what else do you have. Highlights, okay. Then, next.
So these are our main
users, okay.
all this.
Okay. Next. Please be careful of spelling mistakes in your slides. Huh? Supplement is spelled with the E. Anyway, next. Acha, that's it.
Yeah.
Okay. So there is no comparison per se in terms of the prices in the market, what you would like to price the product, all of that. मतलब Excel sheet नहीं है.
Yes, ma'am. Because for mentioning those companies as an example, it is good. But to demonstrate like how they are not good, they are not very good in front of us, that's not a very good thing, as I think. So that's why.
Smart talk हमारे साथ थोड़ा कम चलेगा.
No, ma'am, no smart talks.
अच्छा. The next thing, I'm just giving you a more educative
Yes,
answer, is that, for instance, Amway, right? Okay. They have an MLM structure, right? Multi-level marketing. So you have done the study with the products. Have you done the study with the marketing also? What is it that these people do for marketing? How is it that you can, create a marketing system of your own?
Ma'am, basically, we are on the platform, or we are on the way to involve all the colleges in it, under the Satwa organization, and we can. Yeah. So we are considering all the colleges, and we can give the student a kind of an internship inside the college itself, and they can make these products as well as the other. If they have some ideas in mind, concept of cosmetics or nutraceutical, etc., they can approach us, and we can grant them that okay, you can make this and everything. That, man, I think mouth publicity will be more, rather than the advertising it on Instagrams and social media.
But you are helping them for production.
Yes, ma'am.
You have not created a plan for marketing.
Ma'am, it can act as a marketing plan as well.
Just think it through.
Yeah.
Okay, I don't want an answer right now, but it is important that you think through that to figure out how you can probably involve them in the marketing process also.
Sure,
Yeah?
ma'am.
Okay.
Sure, sir. Yeah. Any questions? Yeah. Thank you, sir.
Thank you. That was a very creative idea. And the next team is Ganeshan team.
Thank you, ma'am. Thank you, sir, for your cooperation. So, good morning, sir. Good afternoon, sir, ma'am. Myself, Ganesh Prajapati, and he is Galesh Mate. We are from Asian College of Pharmacy. So, sir, what comes in your mind when you think about the word ATM? The answer is the machine which gives us money, isn't it? The all-time medicine, ATM, is the totally complete and unique concept made by us, which gives medicines in exchange of money. So, as we all know that when we visit a multi-speciality hospital, there is a rush between doctors as well as patients. There is no time whenever an ophthalmologist patient comes, some type cardiac patient comes. There is no conversation between patients and doctors as much. There is only rush between them. So, as we all know, let us consider a situation that a patient is admitted in the hospital at midnight. All the nearby medical shops are closed at the moment. All the nearby medical shops are closed at the moment. What the first thing that whenever the patient needs the medicines in urgency, what he will do, the relatives will go to the medical shops. But at the midnight, all the medical shops are closed at the moment. So first, only one medical shop, that is the hospital integrated medical shop, is open at the time. So the relatives or the patient goes over there. What he sees first is the massive crowd and the long queues for getting the medicines, due to which there is a time delay to get the medicines to the patient. So here our medicine ATM comes in action, where the doctor will provide the digital prescription to the patient. This digital prescription can be inserted in the ATM, where next verified. Patient details are displayed on the screen. Next, the prescribed medicines with the dosage form will be displayed. Next, the total bill. What is the total bill it will be? Next, it will show, yes, press 1, payable amount. Next, it will ask for the payment method. Let us select one. Yes, let me. Come this side. Yes, we have inserted the card. Yes, next. 2. Enter. Your payment is getting processed. Payment is successful. Payment is get processed. Press the red button to get your medicines. We are pressing it. Sorry. All the medicines with the digital prescription are allotted with the digital print and also the prescription, which can be referred by the patient in the future itself. Thank you very much. This is our model. Next.
You have more slides to show?
Yes. The same concept, whatever I have told to you, the same concept I have also written in this PPT itself.
So again we come to this good product, but what about the strategy behind it?
So ma'am, it is a ATM which can be placed at the massive crowded places such as multi-speciality hospitals, which can this ATM can be placed with the collaboration of the doctor as well as the pharmacist. So at the places where there is a crowd between the patient and the doctor.
What is the installation cost?
Installation cost. Actually, sir, we have just prepared an idea itself. So we have not think about yes, we are working on the software and also the installation process, but we are thinking about how it will work first. Will it affect the society? Will it give us the profit and also solve the problem in the society itself?
With the profit के लिए you have to understand your cost and expenditures.
Charges लगते हैं. Yes, sir. Yeah. Okay.
or no?
Yes, no.
So as ma'am has said just now that is there any installation charges for your ATM machine? Yes or no? So this cost will be beared from the patient side.
Okay.
The billing will be increased and the cost will be beared by the patient. So why the patient will think to utilize this machine?
Actually, this is the concept
as compared to the existing medical store.
Actually, this ATM will be planted at the massive crowded places, and this is the collaboration process. This ATM will be placed at the collaboration process with the help of pharmacist as well as the doctor.
As like one thing, see, as like for any product, if you buy or if you purchase 100 rupee product only, we'll have to pay the GST charges. Yes or no? CGST.
Yes.
9 plus 9, 18% charges will have to bear.
Okay.
So for purchase of medicine from your machine, GST will be there. In addition, your machine charges, machine cost will be there added into the.
Actually,
bill.
we can take a rented charges, such as this medicine is there. So
have you defined your strategic plan to launch your machine into the market? Define it strategic plan is there or no? Or just you are saying in that way?
actually, it's just an idea. We are getting lots of struggles, we are getting some. Sorry, we are not defined.
One thing, okay, okay. Second thing, see, your machine is totally dealing with the medicines and healthcare product.
Yes, ma'am.
Isn't it?
Yes.
If any by default, you forget of the mistakes. By default, if any single mistake happens over there, for an illiterate patient, illiterate, uneducated, and at the remote areas patient, if he or she consumes the medicine prescribed or dispensed by the machine, then what will the impact over the patient's body?
Actually, sir, whenever the doctor.
Have you checked the accuracy and preciseness
Yes.
of your machine before to launch?
Yes, sir. Actually.
Single mistake won't be beared by any of the patient
Yes.
in the society.
Yes.
Yes or no?
Yes. Actually, whenever we plant this ATM, as it is a collaboration between doctors and patient, whenever we collaborate with medical store and the doctor provides us the list of the medicines which he will be prescribed with the patient, to the patient. So same we can tie up with the medical store, and the medical store, he himself will be store the medicines in this ATM through which
I am speaking about at the time of dispensing and running the process 1, 2, 3, 4 stepwise manner.
Yeah.
In that case.
Actually, sir, whenever.
See, machine is there. Machine equipment is there. Chances of mistakes or any failures may be there. We'll have to accept this. We'll have to accept this.
Yes.
And in healthcare and related products, we cannot accept the mistakes. Yes or no?
Yes.
So what are the chances to survive into the business?
Actually, sir, whenever this dispensing mechanism is there, whenever the doctor prescribes the medicines, it has a barcode. It has a barcode, as we have. All the medicines have the barcode itself. So whenever the barcode of the prescribed medicines and the medicines inside the ATM gets matched, the medicines gets dispensed from the ATM. So there are less chances.
Yes, this is a good product, but think about the जो अभी pharmacist बाहर निकल रहे हैं उनका job खा जाएंगे ना ये? तो इतने जो फार्मेसी कर रहे हैं क्या होगा? तो
नहीं सर, फार्मासिस्ट ही तो इसमें दवाइयाँ डालेगा ना सर?
अरे भैया, हम डॉक्टर को आपसे ज्यादा जानते हैं. डॉक्टर क्या करेगा वो आगे जाके? वो खुद ही लगा देगा ना वो. तो और as per the act, as per the act, you cannot sell medicines without registered pharmacist.
Register, yes, without registered pharmacist. So the chances of getting the misuse is less than. Thank you, sir. Thank you.
Thank you. That was a really brilliant idea. So the next candidate is Shivraj. Please come on the stage for the presentation.
Hello everyone, good afternoon. So I am from Srinagar College of Pharmacy, Pune, Vadgapudru, first year I am from. So whenever you find problem, there is a business, according to me. So in near our hostel, there is one fruit shop. Whenever I visit fruit shop, I see some fruit get spoiled and they get damaged. म्हणजे आपण म्हणतो ना खराब झाले, खराब हो चुका आहे वो पूरा. तर मला काय वाटतं की आपण ते त्यांचं शेल्फ लाईफ कसं वाढवू शकतो, तर मी त्यावर काम केलेलं आहे. तर हे काही प्रॉब्लेम आहेत. दीज आर सम प्रॉब्लेम्स ऑफ फ्रूट्स आफ्टर शेल्फ लाईफ इशू, पोस्ट हार्वेस्टिंग इशू, माइक्रोबियल इशू एंड मोस्ट केमिकल कोटिंग एंड द पेट्रोलियम वैक्स. आपने कई बार सुना होगा कि फलों के ऊपर बहुत सारा केमिकल का कोटिंग होता है, तो वो छोटे बच्चों के लिए या जो प्रेग्नेंट वुमन रहते हैं उनके लिए हार्म रहता है बहुत. तो मैंने उस पर बहुत काम किया. तो ऐसा हो सकता है कि जो एडिबल कोटिंग हम बना सकते हैं, बना के फ्रूट पे अप्लाई करेंगे तो वो किसी को हार्म भी नहीं होगा और वो वाटर सोल्यूबल भी होगा. जब आप वाटर से वॉश करेंगे तो वो इजीली निकल जाएगा. सो मैंने कुछ इंग्रेडिएंट निकाले, कुछ रिसर्च पेपर चेक किया, तो वहाँ से मेरे को बहुत सारे इंग्रेडिएंट मिले. तो मैंने कुछ इंग्रेडिएंट चूज़ किए जो इजीली वाटर सोल्यूबल है और आपके बॉडी में भी ये गलती से भी चले गए तो इजीली एलिमिनेट हो जाएंगे. सो मैंने काम करके उस पर एक प्रोटोटाइप बनाया जो हम फार्मेसी में जब फाइनल के प्रोजेक्ट करते हैं ना तो बनाते 3 प्रोटोटाइप बनाते, F1, F2, F3. तो मैंने डिफरेंट कॉन्सेंट्रेशन के 3 प्रोटोटाइप बनाए. तो मेरा फर्स्ट प्रोटोटाइप था जो स्टेबल रह गया और उसको इस्तेमाल करके मैंने जो एप्पल रहता है ना, जो मोस्टली एप्पल हर सीज़न चाहिए हमको, डॉक्टर बोलता है ना हर दिन एक एप्पल खाओ और बीमारी से दूर हो, तो मैंने एप्पल चूज़ किया. तो उस पर मैंने लैब में टेस्ट किया. तो जो बाहर के जो कोटिंग रहता है वो क्लेम करते हैं कि हमारा मिनिमम 15 डेज का रहेगा. तो मैंने जब बनाया और अप्लाई किया तो देखा तो ये तो 20-25+ डे एप्पल हमारा फ्रेश ही रह रहा है और जो वाटर से आप उसको धोएंगे तो वो इजीली क्लीन हो रहा है. तो ये देख सकते हैं यहाँ पे एक नॉर्मल है और एक मेरा जो बायोडिग्रेडेबल और एडिबल बोल सकते हैं वो है. जो नॉर्मल है वो खराब हो रहा है आफ्टर 20 डेज. जो मैंने जो कोटिंग करके रखा था तो वो आफ्टर 20 डेज भी वैसा का वैसा ही था. तो मैंने क्या किया, वेंडर के पास गया, उनको बोला भाई साहब हमने ये ऐसा कोटिंग बनाया. तो उन्होंने कहा कि आप कितने में बेचोगे. आप इंडिया के जो लोग रहते हैं उनके जेब में से पैसा निकालना तो बहुत मुश्किल रहता है. तो जो बाहर का कोटिंग सोल्यूशन है वो 170 पर लीटर है. जो मैंने लैब में बनाया तो देखा तो अरे यार ये तो 50-60 रुपीज़ में बन रहा है और थोड़ा ट्रांसपोर्टेशन का और थोड़ा मशीनरी का कुछ करके तो हम 80 रुपीज़ तक उसको ला सकते हैं. तो जो फ्रूट का जो मार्केट है ना वो बहुत बड़ा है, मोर देन 500 करोड़ का है. तो हम उनका शेल्फ लाइफ बढ़ा के समझो फ्रूट को बेचना है जम्मू से पूरा केरला तक, तो कैसे बेचेंगे. तो केमिकल कोटिंग करेंगे तो वैक्स कोटिंग करेंगे, वो हमारे लिए बॉडी के लिए हार्म ही है. तो हम ऐसा कोटिंग करेंगे कि ना ही हमारे बॉडी के लिए हार्म होगा और उसका शेल्फ लाइफ भी बढ़ेगा. सो उसके कुछ एडवांटेजेस है जो देख सकते हैं आप. थैंक यू. सो मैंने एकदम इजी वे में बताया है जो क्या बिजनेस रहेगा और जो जजेस के क्वेश्चन रहेंगे आई एम रेडी टू गिव आंसर. यस सर. सर जो नॉर्मल जो वेंडर्स ने मेरे को बताया, मैंने वापस थोड़ा सर्वे किया, 3-4 वेंडर के पास गया तो उन्होंने बताया जब उनके पास फ्रूट आएगा तो मिनिमम 1 वीक में उनका फ्रूट खराब हो जाएगा. चाहे वो एप्पल रहेगा तो मौसमी रहेगा तो एक वीक में खराब हो जाएगा. तो मैंने जो कोटिंग का बनाया, मार्केट में है सोल्यूशन ऑलरेडी प्रेजेंट है, मैं ऐसा नहीं बोलूँगा कि मेरा कुछ नया है. तो मैंने कंपेयर किया कि उनका प्राइस ज़्यादा है 170 पर लीटर, तो मैंने ये बनाया तो 60-70 रुपये में बन जाएगा.
शेल्फ लाइफ कितना बढ़ेगा आपका फ्रूट का?
सर मैं आपको गारंटी के साथ बता सकता हूँ कि मेरा शेल्फ लाइफ 25 डेज प्लस रहेगा. जब मैंने एप्पल को कट करके देखा तो अंदर का कुछ भी ऐसा ये नहीं हुआ था. हम ऐसा नहीं बोल सकते केमिकल लगाया है उसको ऊपर का अच्छा दिख रहा है, अंदर का नहीं, अंदर का भी ये था, फ्रेश था.
Elegancy is not going to differ. Elegancy, appearance of the fruit.
No sir, because these are polysaccharides and जो हमें सिर्फ वहाँ पे कंट्रोल क्या करना है, जो फ्रूट का ट्रांसपिरेशन रेट रहता है ना वो कंट्रोल करना है. तो वो जो केमिकल मैंने निकाले ना,
This is your process.
Yes sir.
As to increase the shelf life of the fruit. So
शेल्फ लाइफ भी बढ़ाना है और जो वैक्सीन के जो किसी को जो
ग्लॉसी दिखाई देगा वो,
हाँ वो
अपीयरेंस थोड़ा चमकेगा उसका।
चमकेगा, बट वो बॉडी के लिए भी अच्छा नहीं सर। किसी को एलर्जी हो जाएगा, जब छोटे बच्चे खाएंगे तो उनको तो
alginate is a polysaccharide,
sir,
is a polymer. So
sir, alginate is a multi property stabilizer,
that is what.
preservative.
But after consumption into the body, so it may provide any kind of harm.
Okay sir, मैं आंसर
being a polymer.
सर मेरा ये मानना है कि ये जो alginate है ना,
And one second one, have you checked the interaction of the alginate with the fruit?
Yes sir.
Or food ingredient, whatever जो भी है.
Yes sir, obviously alginate food के साथ.
And second, next one, whether the quote of alginate is applicable to all kinds of fruits or only the apple?
Sir, it is applicable for apple, orange.
क्या है?
No sir, it is applicable only fruit having some shells like apple, banana, apple and orange, chicus, like fruit, not for banana.
Not for banana.
Okay sir. We are also working other.
This is a logical answer or experiential answer?
No sir, I read some research paper. They said that alginate is good coating for the apple and orange. For banana, there is a different chemical.
Alginate is not producing any kind of harm to the body.
Sir, it is सर मैंने एक देखा कि अल्जिनेट बॉडी में कितना जाना चाहिए, एक रिसर्च पेपर पढ़ा तो वो बोलते हैं कि मिनिमम 10 ग्राम चलता, तो मैंने बहुत लो कंसंट्रेशन बनाया, 0.5 ग्राम का मैंने ये बनाया, सोल्यूशन बनाया उस पे।
Before we eat the fruits, we usually used to wash the fruits with help of water, tap water.
सर वाटर से तो वैक्स नहीं निकलेगा ना, तो ये अल्जिनेट निकलेगा तो
पूछ रहा हूँ आपको,
वाटर सोल्यूबल है सर, ये निकल जाएगा इधर से वाटर।
Alginate, whether it is going to get washed at the time of washing of the fruit or is going to remain over there as a coat?
Sorry sir,
whether the alginate coat is going to get washed at the time of washing?
Yes sir, it is easily removable. If you consume alginate, there is no any harm, it is easily removed because it is already water soluble, it is easily removed from our body.
Okay, fine.
जब आप बॉडी में रहेगा तो तभी वो अपना साइड इफेक्ट दिखाएगा ना।
So now considering the business funda.
सर बिजनेस फंडा यही है कि मेरा प्रोडक्ट कैसे अच्छा है, तो एक तो मेरा कॉस्ट कमी है और ऊपर से
कॉस्ट कैसे कम है
सर, वो दे रहे हैं।
You have any cost analysis?
सर वो सॉरी वो मैंने ऐड नहीं किया, बट अभी मैंने फर्स्ट टाइम में प्रेजेंटिंग माय बिजनेस फंडा, आई नेवर टेक पार्ट्स इन सच, सो मैं गारंटी के साथ बता सकता हूँ कि
to the original fruit cost, your alginate coat cost will be added over there or not?
Yes sir, with alginate added.
Then
एक सोल्यूशन बनाएंगे सर, वो सोल्यूशन हम 60 या 70 रुपीज पर लीटर बेचेंगे।
International market, you showed us one nice bar chart. Indian market, have you analyzed? North America, Europe, I don't think you're thinking of international marketing at the moment, right? You will go into the Indian market, right?
Yes,
have you done an analysis of the Indian market?
मैम इन इंडियन मार्केट अब सभी जगह बढ़ रहा है, तो इंडिया में भी ऑब्वियसली ग्रो होगा। मींस फ्रूट का मार्केट इंडिया का जो पूरा 500 करोड़ का अभी देखा मैंने गूगल पे, तो वो ऐड करना चाहिए था मेरे को इसमें। सॉरी मैम।
नहीं, इन वो बोलते हैं ना कि भगवान भरोसे तो नहीं हो सकता।
हाँ नहीं, करेक्ट है मैम, करेक्ट है।
बढ़ेगा करेगा। You have to study the market where you are entering. It was okay if you were entering the North American market and you had shown me the North American figures, right? If you were अभी आप इंडियन मार्केट ही सोच रहे हैं,
करेक्ट
175 वर्सेस 70 और व्हाटएवर, प्लस यू विल हैड प्रॉफिट टू इट, तो 100 में बेचोगे आप, 70 प्लस 30 पकड़ के चलिए, 100 वर्सेस 175। बट कुछ तो एनालिसिस इंडियन मार्केट में क्या है, कितने यूनिट्स बिक रहे हैं, वेयर इज इट रनिंग, दिस इज अ लर्निंग फॉर एवरीवन। इफ यू हैव टू एंटर द मार्केट, यू हैव टू स्टडी द मार्केट रियलिटीज इन अ वेरी वेरी डिटेल्ड वे।
ओके, आई विल कीप इन माय माइंड।
Thank you. That was a very innovative idea. Before inviting next candidate, I am welcoming our Executive Director and Trustee Member Charudatta Bodhankar sir, who just arrived in the hall. Sir. The next group is Priyanka and team. Please come on the stage for the presentation.
Hello. Very welcome to the esteemed guests and all the enthusiasts of innovation. My name is Priyanka Soni, and with association with my partner Komal Khade, we are here to introduce a concept of auto refill. Auto refill is not only an app, it's going to be a seamless prescription refill with futuristic tech for a healthier tomorrow. It is going to make getting medicines much easier and convenient. Now, it is not going to be only based on the prescriptions. It can be based on when there is eligibility checks during the insurance. It can be a huge help for the pharmacovigilance team to track down all the kinds of monitoring of the drug from the patient, from the pharmacies to the patient. Now, what is the main motto? This is an automatic prescription refill system which is going to streamline and automate the prescription refill, which is going to make it a very faster thing for the patient. If a patient, suppose I'm going to tell you, if a patient is going to a hospital right now and it is having a prescription, I don't think that it is mandatory to give a patient the prescription because he or she may not know what is in it. So it's better if a prescription is going directly to the pharmacy. That is going to reduce the time. It is going to be a very time saving for the patient. The lines are going to reduce, and also the importance of pharmacists will improve because we are going to make this app completely based on the pharmacist's knowledge. Now, these are the challenges which we are going to target. Number one is maintenance of paperwork. My mother is having an autoimmune disease from the last 10 years, and I can see her file is so big. And to have that kind of maintenance, she is relevantly and always saying that I am not able to have the maintenance of the previous years of the prescription. So it is very difficult to handle such kind of paperwork. It is time consuming, as if like patients are creating lines and lines out of a pharmacist, and if we are having a centralized system which is going directly to the pharmacist, they are going to keep the kits or the prescription ready for the patients so that they can come and it's just handy to them. Thirdly, it is error prone. When we are writing some prescription, the doctor writes in some manner, the handwriting is not understood to the pharmacist. So that's why there can be some problems where this can be readability of that prescription can be very difficult. So that can bring error. Last is inconvenience to the patient. If you are going to give them faster medication without getting into the line, it is going to be much better. So now this is the key feature on which the auto refill app is going to be based. Number one is smart refill reminder. We are going to have a calendar in that app which is going to give you a smart reminder just a week before that your prescription needs a refill. Second, a request will be generated to the pharmacies near your, or maybe a regional pharmacist network we are going to be making. That means all the regions, we will going to capture all the pharmacists so that they have a centralized software in which every hospital data of the patient will come, that if I am going to a person that he can have, the pharmacist can have that Priyanka Soni came to my such and such report is there at this time and she is going to come and take her prescription. So that is going to be very convenient for the patient. So that is going to be automated refills. Automated refills can be after every month according to your 3-month prescription, 4-month prescription. Now the real-time inventory monitoring. This is going to be a boom for the pharmacist. We see pharmacists hoarding medicines like anything just to have any medicines anyone is asking, you should have it. So that's why we are just hoarding it, and that's why you have to invest a lot of money while creating a new pharmacy. So if we are going to have such system, this is going to give us a very selective medicines in the pharmacies, And we are going to target a region where if we can see a bar graph also that what kind of patient are in a region, and we can customize the pharmacy according to the need of the patient. That is going to reduce the total stocks of the pharmacies. Then the secure e-prescriptions, paperwork is going to be completely negligible over here. We don't need it, and also confidentiality and privacy can be maintained. Then integrated insurance verification. Now this is also new. When I have any patient is needed to do any medicine insurance, it is very tedious job, because you have to give paperwork from I don't know how many years to check all the eligibility criteria, and the status can also, you cannot also check the statuses very fast. You have to go to certain people, and it is very tedious. So if we integrate this system with the insurance verification, that is going to improve they are going to give instant eligibility checks, and the patient can track the status of their insurance of the medicine till where it has reached. Last, it is 8 to PV. Now why I am saying 8 to PV? We all might know there was a case of ritonavir. Ritonavir was a drug which was HIV infection it was used for. It had some problem which was not studied. It gave some kind of, after a 3-month shelf life, the injectable was converted into powder form. So that was not studied. But the marketing of the drug was done. The patients were taking it very fluently. But then when it came to knew that this is some kind of adverse effects from the patients, we were not able to track that which patient took those medicines. So if you're going to have such kind of auto refill app, we can track exactly at which time, which location we have that vial. And so if there is a drug retrieval emergency, it is going to be a huge aid. Benefits for the patient. Now I have told you in brief, efficient and very speedy prescription, the wait time is going to reduce. Reduced errors, service-based process, we want to target all the elderly patients or all the medically challenged patients, and also like people who live alone. I know my grandmother lives alone somewhere. If she needs anything, there are pharmacies which are doing it with kind gesture, but I want to make it centralized with this software so that they can do it. Faster claim to insurance to check the eligibility criteria very fastly. Data security and compliance using HIPAA. And feedback. This is also important. A patient can write their feedback just like you are using your Myntra app. In that app, you can give like this. You can give feedbacks over here that this medicine such a thing happen. So it can be very easy and very fast for the PV people to understand the adverse effect. Like you don't have to go to the doctor again, and the MR and all that chain is broken there. So the benefits for the healthcare provider is streamlined workflow. Integrated with EHR of the system, the electronic health record will be directly managed by the pharmacists, which are going to give them better job stability, cost efficient, and increased patient satisfaction. This was just a market. According to the market potential right now, I am seeing when we are doing the survey, it is 10 million people till today needs an annual refill, and that is a very big market. So I see that the market projection of this patient can be of 300 billion, because the market in 5 years is going to be people who want service-based processes. They want service-based apps, and they want it to their convenience. This is a competitive landscape which I have seen, which I will tell you with an example. Traditional manual refill which is going on right now, the doctors give it, it has a market share of 50%. This is online pharmacy refill like 1mg, Tata 1mg, Pharmacy, which are working on this principle, which is having a 30% share. And this is a complicated, this competitor X automated system is right now introduced like Practo. They are working on this funda, and the market share is of 15%. Now we are basically wanting to keep our app on this one, the last one. This only I have seen some AI which are working on it. One AI is UQ.ai, HUCU.ai. It is working on communicating with the patients for understanding what their prescription needs are, or if they are not understanding how to take the medicines. This is my area of interest. If I want to increase, I'm going to keep these kind of model in the app. Direct sales I'm going to do, subscription models, so that patients can, regular patients can have a better discounts. And last is, if the patients need more service, we can give them fees of that service and they can apply to it. So impact can be streamlined work, reduced error, and patient adherence to the medication. Any patient which knows the meaning of that medicine, he or she will perfectly adhere to his routine, and it's going to give you a health tomorrow. So thank you. I'm open for questions. Thank you.
You said you want to integrate AI which are available, as in software AI which is related, you want to integrate it with your system. That's what you meant?
I said the motto which I am working on, only one AI tool is working on it, healthcare tool, which is HUCU.ai. So that is the only AI tool which I have seen is properly based on the communication with the patients and customizing their prescription accordingly with secure and confidential prescriptions.
So you look.
Right now it's just in the making, but I have seen which is working is only one. Sir, I think this AI, this app can...
And its utilization by the customer.
Actually, this is not going to be utilized by the customer.
Yeah.
This is going to be utilized by the pharmacist itself.
So that is what? Customer in the sense what? That the person who is utilizing it.
Okay.
Isn't it? So what I want to say, your product sustainability into the market after its utilization.
My market... I am trying to, like, no pharmacist want to...
One thing is that there is only one competitor to you.
Yes.
As per your study.
Yes.
So as to remain into the market for a longer time, so what is your plan? And what is your confidence?
My confidence
so that you can enter into the market.
Sir, I think as a pharmacist,
Yeah.
if today I want to open a pharmacy, I know there is going to be a lot of investments to it. But if I am getting a software which is going to tell me that you have to keep a stock of 1 to 2 lakh only.
How the customer will believe on your product?
I don't...
Customer in the sense the actual person who is utilizing it. The pharmacist.
Belief means I think I am giving this app enough of advantages.
How do you sell your product to the customer? In what sense? Marketing strategy.
Marketing strategy is this only, that I am going to give them an upper hand in the stock management. They can also reduce the drug abuse which people are doing nowadays, taking without any prescription. They are taking any drug. We can monitor it. Like if a patient...
This is the only one aspect, that the drug abuse. It is not in all cases. It's very rare.
I think if I integrate this kind of app, pharmacists will take their job very seriously and they will think as a very responsible person, so that they will think that we are doing some responsible work
Being a pharmacist, why he or she utilize your product?
Because it's...
What is your marketing plan?
It is giving everything...
Again I am repeating. Getting my question? How do you sell your product to the... Why he should buy your product? What is the marketing strategy?
Sir, they are having an ease and increase of patient. Also, they are getting more customers because they are giving it kits. You are getting the kits. Just you go there and your kit is ready.
मी pharmacist आहे, तर मी तुमचा product का घ्यावा?
Because मैं आपको customers लाके दे रही हूँ. The hospitals are directly coming to you.
ठीक है, कोई बात नहीं. Thank you.
Thank you.
Thank you, Priyanka. That was a really nice presentation. And the next and the last group is Sandesh and team.
Hello. First of all, very good afternoon to one and all present over here. I am not going to take that much of time for the introduction myself. I am Mr. Sandesh Eke and my group Payal Airway. We are going to present a pharma idea called as the Pharma Nirvana. We are from the Ashok Ramane College of Pharmacy, Pet Vadagaon, Kolhapur. Okay, the next point will be carried on by a group member.
Establishment of the medical shop needs. For the establishment of the medical shop, we need prime location as well as the premises and the hospital and doctors nearby our location. But our business strategy does not need any one of them, because we not need huge money, and there is no need of doctors and hospitals as well as the prime location and the premises.
Okay, then let's move on to the overview of our main business development plan. First one is the medical shop owner. How the medical shop owner will get benefited. If the patients are attracting towards that medical shop, he or she will be get benefited if he is getting more and more profit. First of all, we are going to open this medical shop in the rural areas. First of all, then next point is the our second group members, that is the counseling team. Counseling team will consist of the medical professionals, which are those will be going to the doorstep of the patients. They will be collecting the data, how much medicines they need weekly or monthly, and they will be inserting the data in the software or the website we have made called as the pharmanirvana.com. Then the next point, that is a delivery boy. Delivery boy, which are these are poor and needy people. They are they are eager to earn for their survival, which they are also not having enough money. They are unemployed. And also the fourth point, that is the patient satisfaction. Patients will get satisfied if he or she is getting the medicines with 10% of the discount. He is getting them if the patient is unconscious, not able to go to the medical store and to buy the medicines for themselves. So the delivery boy will go take that medicines after the order of the medicines from the patients. Then delivery boy take that medicines from our medical shop, will go to the doorstep of patients, and he or she will be delivering the medicine. The next point is the main development plan. It consists of the 5 steps. First one is the establishment of the medical store at free home place. Our medical shop will not investing more money on the rent of the room or the where the medical shop is opening. We are going to open it at our free place at our home only. Then the next one, that is development of a software and counseling team. As I have told earlier, in the counseling team, it consists of the medical professionals, and also instead of the software, we have made a website called as pharmanirvana.com. We are going to introduce our website later on. Then the third point, that is the interaction with the customers and the collection of data. That counseling team will go to the doorstep. He or she they will be collecting the data that which medicines they need, or they are having periodical or monthly, how many medicines, such as we can call it as for the chronic diseases, etc. Then the fourth point, that is the purchasing of the needed medicines. Only that much of the medicines the medical shop owner will purchase from the wholesaler, because nowadays medical shops are purchasing lots of medicines, so the investment will be more in our medical shop. Only that much of the medicines will going to purchase by the medical shop. So in this, the investment for the medicines will be less. Then the fifth one, that is supply of medicines through delivery boy. As I have told earlier, the delivery boy will be going to supply these medicines to the road which are unconscious for the patients. Then the next point, that is the assets of our plan. First point, that is the low cost medical shop, where I had told earlier that the investment will be less. Then the free space, free counseling jobs for the poor and needy people, which are those which we are going to hire them as a delivery boy. Then we can also give 10% discount for the patients, which are because of that they will be get attracted towards our business, and free home delivery of the medicines with free counseling and also free medical checkup. Then next move on to the medical shop owner. As I have told you, medical shop owner will get benefited if he or she attracts more and more customers for themselves. The next one is the delivery boy. Delivery boy, poor and needy people, amongst 42.3% of the graduates in according to data 2021, amongst that 42.3% of graduates are unemployed. So for that also, not only graduates, also for our our medicine which are poor and needy people, only that people or that students we are going to hire them. Then Next one is the customer. The customer will get satisfied if he or she is getting free before time service. Hence, no dose will be missed because we are going to deliver the medicines one day prior to the dose of the administration of the drug. Then the last point, the main funda, that is how the financial gain will be generated. First, this was just an example that how the financial gain will be generated. First, if we invest 1,000 rupees, amongst that 20% discount we get from the wholesaler, so 200 rupees profit we will get. Amongst that 200 rupees, we give the 10% discount to the customer. It means amongst that 200 rupees, 100 rupees profit we have. Amongst that 100 rupees, 50 rupees we hold as a profit, and 50 rupees will give to the counseling team, which are the medical professionals, and also the other expenses such as light expenses and medical shop expenses. Then the next one, that is where I would like to introduce our website and also our Google form. So I request you all to please scan this QR code of our survey and also our website, so that we'll get more and more feedback for the survey and also the website. So I request you all to please scan this QR code for 5 to 10 seconds. Okay, now last but not the least, I would like to thank the Lotus Business School for giving us this opportunity to prepare to present our business idea in front of all of you. Thank you so much. Our main business plan is to make one medical shop which is different from normal medical shop which are present over here, and also for the we're giving the jobs as a delivery boy for the poor and needy peoples. And I think as per the data I have discovered, 17% of the rural areas, they were poor and needy peoples which are unemployed, and they were not getting enough money to earn for their survival. That's why.
Possible to open a medical shop in a house or a home?
Not yet, but according to the that furniture we are going to. Yes, according to that counseling means we are going to open it at the free home place, because that furniture, the investment cost, and the extra medicines which the normal medical shops will means buy from the wholesaler, only that investment will be less. So also we are going to hire the delivery boy. So that because of that, and this because of this survey we can get the more and more feedback, because in my village, that is nearby to the Malkapur, Donoli, Bambodi, I have recently sent that feedback, and I have received amongst 90% of the positive response. No, in the survey
what are the survey questions?
In the survey questions means they were how many in the home, how many of them are diabetes patients are there, means chronic disease, asthma, arthritis, etc. So for that chronic diseases, if the patients are also, the second question is anyone of them in the house is anyone or unconscious which are not able to go to the medical store and to buy the medicines for themselves, and so on. The 5 to 6 questions are there. Yes, sir, please.
Usually at present also, the medical store people used to provide the delivery of medicines to at the level of home also, as like with the help of delivery boy. So what is the concept from your side?
Sir, according to my concept,
in the case of chronic diseases, see,
yes,
where there is a use of frequent usage of medicines like antihypertensives, diabetes, or cancer, or any other chronic disease.
Yes, sir, absolutely.
In such cases, in such illnesses, the medical store owner or shopkeeper used to provide the medicine as like a delivery to the home, direct to the home, DTH.
Sir, actually not.
This is in case of the chronic diseases where the frequent consumption of medicine is there.
So, because as I have made that the free counseling team before this start.
Second thing, as you said, the opening of medical store at the home level. So, how does it possible? Anyone can open the medical store at the home. It is not a kirana shop. Keep
No
in
sir,
mind.
not at all.
See, मेरे को लगा कि मेरे पास पैसा है और मेडिकल स्टोर ओपन करो, ऐसा नहीं होगा.
Sir, no, not for that. Only the registered pharmacy.
As you said.
Yes, sir.
As you said.
Yeah, sir, only the registered pharmacist. हम लोग मेडिकल शॉप हमारा जो है जो हम लोग ओपन कर सकते हैं घर में, बट वेल फर्निश्ड होना चाहिए वो रूम एज पर द गाइडलाइंस गिवन बाय द PCI, Pharmacy Council of India. So because of, and also the drawers and shutters.
You'll have to follow the rules and regulations.
Yes, sir. And according to the alphabets.
Provided by the FDA.
Yes,
provided by the FDA.
Okay.
ठीक है. ठीक है. And what about the transport? During transport, if any hampering of medicines would be there.
So no, we'll be handling.
Who will take care of the medicines? And how do we take care of medicines?
So
medicines ऐसे हैं जो temperature conditions specified होती है. How do you sell them? How do you transport them at the level of home?
Sir,
by far distance.
so actually for this startup, we're going to hire only open medical.
One of the aspect in a business point of view, isn't it? Some of the medicine needs to be stored at particular temperature condition.
Yes, sir.
How do you transport them? We'll have to maintain the storage condition.
Sir, we can take that cooler bag for the delivery boy. Whether the delivery boy goes by.
This is my advice. This is my advice. We'll have to take into consideration these all things also.
Yes, sir.
Okay.
Okay, sir. Thank you, sir.
Thank you.
Yes, ma'am. Thank you so much.
Thank you to all the participants and the presenters. Everyone has shared something creative and innovative. So I'm sure that every one of us got to learn some or the other thing from the same. So moving further, I would like to call upon the stage Mr. Tushar Pokharnikar sir to make an important announcement. Thank you.
Good evening all. Thank you, Vaidi. I'm sure you would be eager to, get the results of the entire event of poster competition and business funda. So I'm here just to take a small moment of yours and make a small announcement. Vaishri Group is also into a different cell of international education. So education in USA and UK has now become a distant dream. It is not a distant dream now. We have our international cell providing business, MBA, M.Pharm into UK and US. तर एक सुवर्ण संधी तुम्हाला आहे जर परदेशात शिक्षण घ्यायचं असेल M.Pharm, MBA, UK आणि USA या देशांमध्ये तर आपली टीम बाहेर आहे. You can just get in touch with the team and you can get more information about what are the steps or how could you pursue your future education abroad. So this was a small announcement. Thank you, Vaidi.
Okay, so now we will have a 2-minute break, but I request you all to be seated on your seats because we are having a prize distribution ceremony lined up. So have some patience. We will have a break of 2 minutes and we will meet again. Hello, I have your attention, please? So I am here to make an announcement of an upcoming event that is been organized in Lotus Business School. So as you can see here, we are going to organize an Innovate Expo, that is a startup Mela, on 23rd of March. We will be having 50 to 60 startups here, and they will be presenting their products and innovative ideas. So we will be also inviting angel investor, venture capitalist, many of the banks, to make them available with loans for the startups. So they are going to analyze the startups and their ideas, and they will decide to or they will invest in their startup or their businesses. So it's my request, or it's an invitation from Lotus Business School for all of you, that you can just come and you can visit the same. The expo is for all of us, and it's of free of cost, so you can come and visit the same. So it's on 23rd of March, just mark the date. So we will be hoping you coming in our campus and just having a look and getting some new ideas and getting some new learnings from this expo. Thank you.
हॅलो, सर्वांना एक विनंती आहे, बाहेर चहा चालू झालेला आहे, जर कुणाला चहा घ्यायचा असेल तर चहा घेऊन लगेच आपल्या आपल्या सीटवर परत येऊन बसायचं आहे. आपल्याला पुढचा कार्यक्रम लगेच चालू करायचा आहे. थँक्यू.
Ladies and gentlemen, with great pleasure that we...
Student, please be seated.
Ladies and gentlemen, with great pleasure that we will felicitate our esteemed panel of evaluators. Let us extend our heartfelt gratitude to each of them for gracing this event with their presence and expertise.
Now, I would like to request Dr. Satish Vapade sir to felicitate Dr. Sunil Harer sir. He is a principal at D.Y. Patil University, School of Pharmacy, Pune.
Thank you, sir. I would like to request Professor Vivek Keskar sir to felicitate Dr. Ajay Shinde sir. He is professor at SVPM College of Pharmacy.
Thank you, sir. Now, I would like to request Mr. Charudatta Bodhankar sir to felicitate Dr. Devendra Visokar sir. He is Associate Professor at Modern College of Pharmacy, Pune.
Thank you, sir. I would like to request Dr. Satish Varpade sir to felicitate Mr. Charudatta Bodhankar sir. Thank you, sir.
Thank you, sir. Far and away, the best prize that life has to offer is the chance to work hard at work worth doing. With this prizeful saying, let us start our prize distribution ceremony of Pharma Summit 2024. Firstly, we will have the prize distribution or poster presentation. So for this, I would like to invite Vaidai and Rutu for further event.
And now, with a great pleasure and anticipation, let us begin the prize distribution ceremony of poster presentation competition.
While we celebrate the achievement of the winner, let us also acknowledge the effort, dedication and spirit of all the participants who took part in this competition. Each one of you has contributed to the success of this event, and your presence here today is the testament to our commitment to the excellence.
Now, I would like to request Mr. Charudutta Bodhankar sir, Dr. Satish Varpade sir, Ms. Soma Srivastav ma'am, Dr. Devendra Visokar sir, to kindly grace the stage and do the honors of distributing the prizes. I request Dr. Ajay Shinde sir to grace the stage. I would like to request Dr. Sunil Harihar sir to come on the stage.
Thank you, sir. To present this award, now I request Dr. Ajay Shinde sir to announce the name of second runner-up.
Okay, through your poster presentation competition. So this is a runner-up prize for second year. Second, that is Santoshi Lakshman Lashkare and Switi Ashok Sonawni from Peace Modern College of Pharmacy, Nigadi. So congratulations for getting second runner-up prize in poster presentation competition. Thank you.
Thank you, sir. Now may I request Dr. Satish Varpade sir to announce the first runner-up.
First runner-up for paper presentation, Sharwani Santosh Godse from Marathwada Mitra College of Pharmacy. Congratulations.
We have now reached the final award. Next up, we have the winner of poster presentation competition. And to present this award, I request Mr. Charudutta Bodhankar sir and Dr. Devendra Visokar sir to announce the name of the winner. The cash prize for...
And Satish. The winner for the poster presentation, Rajanandani Ratan Lagad and Satish Suresh Bhoj. Sorry, Sakshi Suresh Bhoj. Congratulations.
The winner has got 5,000 cash prize, 7,000 cash prize. Many congratulations. First runner-up get 5,000 cash prize and second runner-up got 3,000 cash prize. Many congratulations to you guys.
I request all the dignitaries to please take a seat.
There is a small confusion. Please, all guests, please on the dais, please. There is a small confusion from student side. Please.
So here's.
So here is time to announce result of Business Funda competition.
So now I request to announce the name of second runner-up.
Second runner-up for Business Funda competition is Sandesh Shelke and Payal Yadav. Congratulations to both of you. And team Ankush Rao Mane College of Pharmacy. Sorry, Ashok Rao Mane College of Pharmacy.
Congratulations, Sandesh and Group. Sandesh and Group got the 5,000 prize for these.
I request Shoma Srivastav ma'am and Dr. Shinde sir to announce the name of first runner-up.
Okay, the winner is Ganesh Prajapati and Kailash Kiran Mate from Asian School of Pharmacy, Pune. Congratulations.
Congratulations, Ganesh and Group. They won the cash prize of 7,000.
Now, finally, it's time to announce the winner of today's Business Funda competition. So, I request Mr. Charu Datta Bodhankar sir to announce the name of winner.
The winner is Manas Joshi, Poonam Narwade and Sai Sutar. Congratulations.
They won the 10,000 cash prize. Congratulations, guys. Congratulations to all the winners and the participants who participated enthusiastically. Thank you to all the dignitaries. I request Rutu and Vaidai to carry on for the event.
As we draw the curtains of Grand Pharma Summit 2024, I extend my heartfelt congratulations to all the winners who have showcased exemplary innovation and dedication in the pharmaceutical industry. Your groundbreaking contribution promise a brighter and healthier future for all. Together, let us continue to strive for the advancement that will positively impact global health. Thank you to everyone who participated, and may our shared vision propel us towards even greater achievement in the years to come. Now it's time to propose a vote of thanks, so I would like to request Professor Prajakta Gazare ma'am on the stage.
Good evening, everyone. On behalf of Lotus Business School, I, Professor Prajakta Gazare, extend my heartfelt gratitude to all our esteemed evaluator, dedicated coordinator, enthusiast, volunteer, all participants, our Executive Director, Mr. Charudatta Bodhankar, sir, and our Director, Dr. Satish Varpade, sir. To our evaluator, your expertise and constructive feedback have been instrumental in shaping the learning experience of our participants. We appreciate the time and commitment you have dedicated to ensuring the quality of this event. I extend my gratitude to our Executive Director, Charudatta Bodhankar, sir, and our Director, Dr. Satish Varpade, sir, for their guidance and support throughout this event. I extend my gratitude to all the coordinator and student volunteer for their meticulous planning and seamless execution. Lastly, to all the participants, thank you for your active engagement and enthusiasm. Your passion and commitment have truly made this Pharma Summit 2024 collaborative and enriching experience for everyone. And lastly, congratulations to all the winners. Thank you everyone. Now I officially declare that today's conference, Pharma Summit 2024, is over. You may proceed for the certificate collection. Yes, thank you, sir. I request all the winners to please come on the stage for group photograph. All the winners. I request all the winners to stay here and come for the group photograph. Sir, apply. Yes. Also, I request all the staff members to come for the group photograph. Chalo, all the winners. एकत्र पण एक काढू आणि